I am Joe Restuccio, the co-chair.
And I am Maria Ortiz, the other co-chair.
Let's go around the room.
Go ahead.
I'm Martin Ray.
Anybody else?
I'm Hector Vasquez, Community Board 4.
I'm Leslie Williams.
Josephine Ishman.
Hi, James Wallace here in Chelsea. Happy to be here, proud to serve.
Nellie, you can take Matt out temporarily.
Yes.
And we've been joined by Katie Stokes, new committee member. And Robert Tan is attorney for which one?
I'm not an attorney.
Oh, it says Robert Tan, attorney on your placard.
I know. I'm an architect.
Okay. All right. But representing who?
525 West 45th Street.
The owner or the tenants?
Tenants.
Okay, fine. And then we have tenants from 45th Street. So before we start that, we're going to do a quick report on homeless shelters in the board. Maria's going to start off, and then I'll give you some specifics.
Quick question, not a question. Let me just give the spiel about how it works
Yes.
really quickly. So just in case someone is online who's never participated before, this is just very briefly how it runs. Everyone is going to stay muted throughout the meeting. Only the speaker or the presenter will be allowed to unmute themselves and speak. After a presentation, committee members will comment or ask questions first. Then the members of the public, also known as attendees, will be able to ask questions and or make a brief statement. Next, the committee will report any testimony or correspondence the board office receives prior to this meeting related to the item. On some items, after a public comment, there will be a discussion and a vote by committee members to write a letter of support or to make recommendations. The important part of this all is to actually be able to speak. If you want to ask a question or comment, you have to press the raised hand button. It should be on the bottom of the screen, right? I don't remember where it is right now.
It depends upon your device, right?
Yeah, but there is a raised hand button, and you have to press that in order to be able to speak. And if you're on the phone and you're calling in, you have to press *9 to raise your hand. And then finally, when the agenda is finished, the meeting will be adjourned. If anybody has any questions, if you can put them, I guess, in the Q&A if there's any questions. Nellie, you're monitoring that if there's questions?
Yes, I am.
Okay, great. Thank you. Brief summary update about the homeless shelters, the temporary shelter relocation sites in our community. And Joe, I guess you can add to it, but just very briefly, due to the pandemic and a lot of shelter sites where there's individuals that are in congregate settings where several individuals even sleeping in a large space or eating in a large space, they've had to relocate them to hotels often where there'll be one, sometimes two people in a room. And in our community between 36th and 57th Street, we've had quite a few that have been relocated into this community, totaling about 2,100 beds. I should also add that about 3 sites have also been relocated elsewhere. We've had Community Board 4, particularly this committee, has had several meetings with DHS demanding more notice because this community works best with communication and collaboration. We've also had several meetings with the nonprofit providers of the different shelters that are in the community. And when we meet with the nonprofit providers, we're talking about, or we ask about and discuss services to the clients, staffing, security, and that is an ongoing discussion that we've been having, including tomorrow we have some meetings about that. Joe, if you want to add at all. Did I lose Joe?
I think we did.
Okay, well, while we get Joe back, the other thing that I think is significant to mention, oh, that's Joe. Give me 1 second. Nellie,
Yes.
he might be coming in again under attendees.
Okay.
I don't know if maybe perhaps if you have time, I don't know if you can wing it also and email him the correct link.
Okay.
The other thing that's important that I should mention is the fact that this meeting that we're doing is public. The agenda is public. This meeting is being live streamed on YouTube. It'll also be recorded and accessible to watch at a later time. I apologize I didn't mention that earlier. And I gave the updates, and I'm wondering if we got Joe back yet.
No, we haven't.
Betty raised her hand.
Oh, Betty, you did raise your hand. So let's have Betty speak while we're waiting for Joe to join. I'm assuming you have a question, Betty.
You're on mute.
I don't hear you yet. I still don't hear you, Betty. Nope. Maybe you can type your question in the Zoom chat. Or I know someone was there helping you a few minutes ago. Maybe if they can come back.
Betty? No, still can't hear you, Betty. I unmuted you.
Well, in the interim, I think she's going to get some help. Katie, did you introduce yourself already?
No, and I had a quick question. So.
Okay, good. So if you can ask your question, go ahead.
So yeah, I am the newest member of this committee. So hello to everybody, and I look forward to being on this. I just had a quick question, Maria. You said that there are about 21 sort of hotel beds that are being used now in the district from people from congregate settings. And then you said that
2,100.
2,100. And then you said that 3 congregate setting places had relocated outside of the district. I'm just wondering, so like what's the total, like how many beds was that left? So total, how many new do we have in the district?
So most of that number that I just gave you is new to the district. Very few have left. And even so for example, I can give you a quick example. So Care for the Homeless had the shelter on 52nd Street between 9th and 10th Avenue. There were 120 women there. That was a congregate setting. And the Wynn on 51st Street had approximately 60 women, also in a congregate setting. So both of those sites had to relocate due to the pandemic, right? And on 51st Street came in, if I remember correctly, I'm thinking about 200, it's between 200 and 225, possibly a little more. I can't remember the number right now. So if that gives you a little idea of what I meant when I said about 3 sites had relocated.
Okay.
Those were the 2. I just mentioned 2 of them.
So it sounds like about 200 or so left, but then we've gotten a lot more in. Okay, I was just trying to get a sense of the delta. Yeah, okay, thanks.
Yeah, exactly. Does anyone else have any questions about that?
Leslie's raising his hand, and Betty's still trying to speak.
Yeah.
No, you can hear me now.
Oh, we got Betty.
Yes. And I'm sorry, I missed the answer to Kay's question a little bit. So forgive me if I'm asking a similar question. The shelter folks who came from the Lower East Side, that we had to spend a very long conversation about at the last meeting. Where do they fall in these statistics in your updates? Everybody, like, we wrote a letter, the board wrote a letter saying, we want these people to be somewhere else.
The WJ.
What?
Right,
The WJ.
right.
The WJ is the
Right.
hotel. Yes.
So,
Katie did ask a similar question.
oh,
So at that site, about 200 and approximately 25 men, I can't remember the number right now, came in on 51st Street. And what I was sharing with Katie is that, I guess you could say in comparison, to give you an idea of how many people left the district, at Wynn there was about 60 women more or less, and at Care for the Homeless, which is like 1 or 2 blocks away, there was about 120 women. I don't know if that helps give you an answer.
no, well, I just wanted to know the fate of the facility that everybody was so upset about in terms of, and we wrote a letter saying, you know, we didn't get any notice and this is not a good place to put this, it's saturated block. So what, did something happen or are all those guys still there?
They're currently still there.
So-
We're still having meetings with DHS that are ongoing, not only about that site, about other sites that exist as well that are in the community. And Leslie, you had a question, and then Josephine. Leslie?
Yeah, that was my question.
Oh, okay.
And so
Yeah.
they're still there. They're still there.
Yeah.
What about the
Yeah.
the 330 West 51st Street? What is the status of that group?
It's
That's Lantern.
330 is when?
Lantern.
No,
Oh, Lance.
okay,
Lantern.
we're actually, hold on a second, 1 minute. We're talking about the shelters tonight. We're not talking about Lantern, because that's not a shelter. That's our first item on the agenda, so we have to stay focused. And the second thing is, we did not get any response whatsoever from DHS about this or from HRA. And Maria, have you already read out the list or not?
A list of what? You're talking about the
Of the shelters.
yeah, I have the list.
No, have you already
Do you
read it
need-
out? No, I have it. So
No, I did not.
okay,
I did not.
I want to just give a broad context on what we're dealing with tonight and understand that we're not going to come up with any solutions, but I think we want to take a very strong letter as a follow-up to our prior letter. Since we have met last month, we have the following locations where there are now shelter beds. The Comfort Inn at 343 West 44th Street, the Comfort Inn at 548 West 48th Street, the Washington Jefferson at 318 West 51st, the Watson at 440 West 57th, Spring Hill Suites 338 West 36th, Doubletree 341 West 36th, the Skyline Hotel, which had been used partially as a family shelter, is now a single shelter, 725 10th Avenue between 5th and 51st Streets, Hilton Garden 326 West 37th, and Cachet Hotel 510 West 42nd, which was also a family shelter. We are now looking at over 2,100 beds that have moved into our community in the past 3 weeks. And this is an absolute, and DHS has been, to say they've been uncommunicative at best is being nice with this. So we are really seeing a poor management for a major public health emergency, and it feels very much like this district is being incredibly overloaded with shelter beds, and all the ones I just mentioned are single men or single women. Now, there's varying degrees of management. The one on 57th Street, the Watson, I went by there today in preparation for this meeting. You do not see people hanging out. It is very well managed. There are a lot of staff there, and you can tell it's very well, I mean, you can tell that given the situation, it's not a problem. However, on 37th Street, the Hilton Garden, there I saw 35 men hanging out and drugs being sold and lots of activity in front of the building. So it really depends upon who the various sponsors or operators are. And everyone should know, unbelievably, that for the Skyline, it's Acacia who was the operator of the Aladdin Hotel. So the idea that DHS would bring the operator of the Aladdin, which was a untrammeled disaster for 45th Street and bring them in the skyline. So I would say we're going to go around the room and talk about this briefly, but we know we have a big job to do with DHS and HRA, and they are simply not communicating, and furthermore, not really engaging as to how you manage this at all. So let's go around the room and go ahead, Maria.
And Josephine had her hand raised.
Yes, so many of our students in Community Board 4 were actually residing in the Skyline Hotel, and we had no idea what happened, just they were moved overnight.
Yeah.
Where did they go, and why is this being allowed to happen? And they're just overnight turned into these single room hotel. What's going on?
We have almost zero management or strategy by this mayor's office. We get no information. We knew there were many students going to PS 111 at the Skyline. And then all of a sudden, the community board asked the question because we saw single men outside, like, what's going on there? Maria noticed it. And now DHS advises us, families have been moved. Now it's all single people. There is no plan here at all.
Oh.
Paul? You're on mute, Paul.
There. Well, I'm sure I'm not the only person who's astounded that the 2,100. We have 2,100 new neighbors. Well, Joe, I'll just take it at face value what you've said. It sounds astonishing to me. That's even more so because that's right around the corner from my house. The Skyline is. You know, for years and years and years, it was a fine, thrifty European traveler staying hotel, and now it's not at all. I was just saying to my wife, I was noticing the other day, in my little corner of Hell's Kitchen, more than half the people seem to be walking around with masks on, and everyone in the store had masks on. Do we have any overall view yet, Joe, as to how healthfully safe, how physically distancing these populations are? I can't imagine that they're terribly good at that, are they?
All I can say is that both HRA and DHS have been very vocal in distributing masks to tenants, people in shelters, and there's a lot of opportunities for masks. I know this from the supportive housing. They're constantly offering us TPE. The problem is that when you don't have a full functioning social service staff, how do you manage that? It's not just about the people; it's about the social services that they're getting support for. So
right. Well, I thank you very much for the information, because literally yesterday I was walking down 10th Avenue to the one of the few remaining hardware stores in my neighborhood, and saw a fellow there who I had never seen before, and he did not fit in with with we all know our little speck of the neighborhood, correct? This was a newcomer. This was a fellow wearing very strange conglomerations of clothes. Now, he had a mask. Unfortunately, he was wearing it below his chin, and behaving eccentrically. And well, anyway, that explains it. I'm very glad to have that mystery solved, but I'm not happy that we have yet another problem on top of the normal problems that shelters bring every neighborhood, wherever they are. We do have more than our share, but this is a curveball that nobody welcomes. And that's it.
Betty?
I don't know whether you've thought about this, but I would think that we should write a letter. The full board should send a letter with these statistics about the 2,100 beds and the families that were disappeared from the
overnight.
And I think it should go to the mayor and everybody else and every elected official. And I don't know, I feel like they've decided that this is just a dumping area that every, sort of budget hotel or moderate hotel. And I feel very upset about this. Are we going to head to some kind of statement?
Yeah, I'm just getting sense around the room first.
Okay.
Hector?
Yeah, I've been pretty concerned about this since the get-go. I mean, I understand that it's a way for the hotel to sustain the business, but it was supposed to be only a stopgap measure in the hopes that maybe some real housing would be provided for these folks. And it looks like it's turned into something else. It's evolved into maybe a cash cow for these hotels, and maybe there's something going on we don't know about. You know, I don't want to accuse anybody, but it almost seems like, you know, the rooms are empty, so why not charge the city? And I don't even get to know what they're charging for these rooms, and it'll continue to do so unless, yeah, we need a very strong letter to be sent out and say, hey, what are the plans here to get these folks into some real housing or a real facility that will help them, not just the stockpiling in these rooms, which is probably jeopardizing, you know, maybe guests that are there as well, or you know, the community at large.
They've taken over the entire hotels in most cases.
In most cases, okay. That's great for the hotel, but not great for the community, obviously. You know, I mean,
Right.
if it's well run.
Not when there's a saturation.
Yeah, exactly. I guess my concern, we had discussed in a previous meeting about security and policing involved in, you know, an increase because of the situation there. Was there any results from that at all?
Well, I mean, for example, the Watson on 57th Street, there's a full contingent of security from the organizations. They brought their security over from the shelter. And that's why I think we're seeing it very well managed, because it's not, I mean, you walk by there, it is not a troubled block, right, Maria? Over there, it's not at all.
Right.
Right.
On 57.
Well,
yeah.
Well, then maybe
I've
we
walked
should
by
use
several
that
times.
as a, yeah, maybe we should try to use that as a baseline to push on the other hotels that are doing the same thing and say, hey, you have to have this level of security in order to continue doing the, you know, operating it with this business model that you have now, even if it is a temporary measure. You know, maybe it has to be a requirement for all of them in order to ensure that the community, you know, stays safe and it's less disruptive for the neighborhood.
Katie?
Thank you, Hector.
Sure.
Sorry, I was unmuting myself. Unfortunately, I fell off the internet. So I missed.
Welcome back. Me too.
Exactly. So sorry. So I fear that I probably missed some important numbers that you shared, Joe.
2,100 beds in the last 3 weeks.
Yeah. And in fact, I think while you were off the internet, while I was still on, I had asked Maria, like, I understand that there were 21 added from congregate shelters outside or congregate settings outside moving in. And then she had mentioned that then it sounds like there may be about 200 that had been in congregate settings in our district that then had been moved out. So
yes. So does that make any sense whatsoever that we have a shelter in our district already? We take those people, move them someplace else, and then people from Coney Island and put them here.
Yeah.
Like, the folks are so disconnected from services or what they do. It's just a crazy way to do things.
Well, and I think one thing that we do need to be mindful of, and I think as many of you know, I'm actually on the board of one of the organizations that helps people that's actually headquartered in our district. But, and God knows I'm not privy to a lot of information, but nevertheless, my impression is, from what little I do know, that that these places, they don't want to move either. I mean, they would be delighted to stay in their neighborhood, right? Right. You know, this is not a decision being made by these places. This is what they're being told to do in order to keep everybody safe, right?
Right.
And indeed, you can provide much better services in congregate settings than you can when everybody's behind a closed door. Absolutely. So I think everybody, even these, you know, these organizations, yeah, the operators, they would be delighted if the status quo could have been maintained, but then we are facing this huge pandemic right now. And obviously we're trying to keep people's physical health improved or safe. So anyway, so my impression from what little I know is that these aren't decisions being made at all by the operators. You know, it's DHS saying, oh, well, we found a hotel for you here. Oh, you guys have, you know, 2 cases, then your group is moving there. So I don't.
You mean the arbitrary and capricious without talking to anybody about how it should be managed, whether it's the providers, the people in the residents, or the community? Yeah, I would say that's probably how it's happening.
So, but I guess the thing I would hope that we would be careful about is we don't want to make it look like we are simply saying NIMBY, right? We don't want to make it look like we're saying, you got a big problem, go somewhere else. We just don't want it in our backyard. I think what we want to make sure about, and I think as somebody just said, Hector, maybe it was you, like, let's be mindful of what works and what we care about, right? Like, we want to make sure that people are getting the services they need. And frankly, we want to make sure that they have the security they need to help their people and then also to help the neighborhood, right? So maybe when we react in this letter about what's going on and that we need so much more information from DHS, then it shouldn't just be capricious and everything else. But I think we also need to say, like, there need to be some standards in place about security and about services that are being provided. You know, we don't want to stop people being moved into safer locations. That's not our goal.
I think I have two reflections on that. The first one is that would be a different mayor and a different administration because they are not acting in any way that makes any sense. And the second part is this administration is creating a NIMBY response in our broader community through these very poorly managed actions. It's making people crazy. And people who are calm and manage through it, they're getting angrier and angrier with this because all of a sudden, you don't just move 300 people onto one block and move 500 people on the next block and not expect there to be some sort of response on that. You know, so I mean, this is we have a human thing happening here. We're going to go to James and then Pete.
I'm clearly incensed over this, and having just left that neighborhood, I saw the effects of just one of those shelters opening, the one on 44th. And of course, that was before there was a lot more pedestrian foot traffic. So the change in the safety of the neighborhood was visible almost overnight. I just wanted to highlight that it sounds like there are 4 things we've discussed so far. 1 is the safety, service, and security of the patients. 2 is the safety of the neighborhood.
They're not patients, they're residents, James.
Thank you. Safety of the neighborhood. Responsiveness and transparency of our city government, to include DHS, and responsiveness and transparency of the operators. I think that kind of covers the key things that we've been addressing here. But the last question that I have is, I want to anticipate what kind of response the city might have. Is it possible that they'll argue, and do we have a ready argument in response for them potentially saying that the reason they're all ending up in CB4 is because of the concentration of hotels here? I don't want them to get away with saying that.
I have done my research, and there are hotels in Queens and in Brooklyn. They exist. That's what's so crazy here. The idea you would take somebody from Far Rockaway and move them to Midtown, and then take somebody from Midtown and move them to Far Rockaway. It's just like you know, there's no rhyme or reason here. Yeah. Why were those families moved out of the Skyline? Why were the women on 51st Street moved out of there to another location entirely when they finally were getting settled here? I mean, this, you know, so.
No, I'm with you.
But I think you got the right angle here. Pete, you're up next. You need to unmute, Pete.
I live in the middle of all this, and of course, I'm surprised that I really don't see that many homeless people outside, which is really, really, it's mind-boggling because, you know, you would think that you would see a lot more.
You got to walk around more, Pete. Trust me.
I do, but I've seen a lot more prior to that. And I'm not in agreement as to what, how the city did this. And I'm just kind of baffled why it was done the way it was done. And I'm curious as to notice, so when was this order put in and who knew about this, you know, in the beginning? The fact that we were caught off guard and by surprise, it's just, I just don't know what to say at this point. The community didn't have any input. It doesn't make sense. It really doesn't make sense to me. And I think it's going to get worse before it gets better. That's all I can say.
Martin?
Hi. How many more?
That's a question.
The city has to move fast in an emergency. We should acknowledge that it is an emergency and the executive took it upon himself to act fast. We should acknowledge that and then say no. What about other alternatives? Thank you.
Dolores?
Thank you.
First off, what we're talking about tonight is exactly what we talked about the last meeting. Nothing has changed, no notice, no organization. But yes, no one is saying that we don't want to be supportive of the situation, and it is an emergency. Marty's right, we need to acknowledge that. But there is no excuse for bad management. But more importantly, this district has representation from the Speaker of the City Council, the second most powerful person in city government. And this is what's happening within our own district. I can't imagine what may be happening across the rest of the city. That's not what we're concerned about because we can't speak for the rest of the city. But regardless of the conversations that are happening, how can the second most powerful person in city government not be part of this process and not be able to work with the rest of city government to ensure that there is a process in place which creates the right balance? We were already tipping over the balance in terms of how much supportive services that we have within our district. The fact that there are this many beds in this community is not an issue because they're homeless. It's an issue because we don't have the services in place. And the folks that are being moved here are moved away from their own environments, from their own support systems, and it creates disruption for them as well. We need to be pressing upon the fact that our representation is left out of the loop as well. That really needs to be stressed, that if we happen to have such a powerful person representing this district and this is still happening, this is a failure of the government overall.
Yeah, I really want to note that emergencies demand better management, not, just because this is an emergency, it doesn't mean that you don't step up and figure out how to manage through it. And you really have to. So the fact that we're having this discussion a second month in a row, and my concern is we meet again one more time in July, are there going to be 500 more beds here and a total disarray on certain blocks? It's not going to make anybody want to deal with any social services going forward for quite some time in our district. So I think we sort of talked this through with the committee members. We have questions, Nellie, from the public. I see some hands raised.
Yes.
Can you bring them one at a time?
Brian?
Hello.
Okay.
Hi. Hi, guys. Thank you. Actually, you're echoing a lot of the concerns I have. Just for reference, I live on West 36 between 8th and 9th Avenue. Two of the hotels on my block are being used as shelters. The hotels have, between both of them, 750 plus rooms. Many of the rooms are double occupancy. I do not know what the population that has been brought into the hotel is, but it has had an incredible impact on the block, an incredible adverse impact on the block. Already 36th Street is home to supportive housing in the form of Barber House. And we also have several methadone clinics and needle exchanges in very close proximity to our block. So our neighborhood is already dealing with a lot of social issues. We've now added 500 plus homeless shelter men onto our block, and it is radically changed the dynamic overnight.
Brian,
Residents,
it's 518.
518
Yep.
is the total number of men. Okay, there are more rooms, so they can move
Right.
more people in, but
Right.
currently
But
518.
that's
Those
the
are the numbers.
population of the two shelters that were moved to this location.
Okay. The shelters, by the way, were moved from the Bronx to our location. And one of the main issues is that the men are loitering on the street, even though they have to wear masks within the hotels, they're not wearing it on the street. It's impossible for residents of the street to walk up and down the street and maintain their social distance when the men are loitering under street sheds. There's all sorts of verbal altercations throughout the day. And I've been verbally accosted, my neighbors have been verbally accosted, and we are concerned about our security and safety. We understand and appreciate the reason for reducing the shelter populations and housing these men, but if the purpose is to create social distancing from them, they need to adhere to it on the street. There is not adequate security, there's not adequate social services. And on top of that, during the day, the men have nowhere to congregate within the hotels, so they're out and wandering our neighborhood. And it has radically altered our block. And I didn't know that this was something you guys had already been discussing. I have just emailed Jesse about this in the past 2 days, and I'll forward my letter to Joe and Maria after the call. But one thing I'm wondering if we can consider is, I was told that there's a 90-day term, and at the end of the 90 days, the city reevaluates whether to renew, and
they're actually month to month, Brian.
Month to month?
Yeah, we found that out on 51st Street.
Okay. Well, perhaps they may consider finding, as you mentioned, there are hotels throughout the city, and our block just cannot absorb this population all at once without extensive social services in place to assist the men and make sure that the existing residents on the block are safe and feel secure.
Thank you, Brian. Next person is Catherine Brinkman. Bring her in, Nellie.
Oh, sorry, I was muted. Hey, hi. So, I'm on 56th and 9th, and I'm originally from San Francisco. I've been in New York for 3 years. So, it's nothing new to me, quite frankly. But my concern is, how do we help them? There's still people on the streets. There's a woman I've been actually trying to help get into housing for the last 2 weeks. It was really hard for me to even find a phone number. She's still on the streets. Yes, it's affected my life, but again, coming from San Francisco, it's nothing new. Has it been shocking? Yeah. Do I have to worry about stepping over human feces? Yes. But long term, how are we going to fix this?
So I want to note that part of our discussion tonight is not about street homeless. That's an entirely separate issue. This is about relocation of congregate shelters from various parts of the city into commercial hotels. And
which I have behind me at Watson, and I echo the sentiments of the gentleman, and I agree. What happens when I'm at 56th and 9th, right? So I'm right near Columbus Circle. So when they are no longer in the hotel, what happens? How do we help them now?
Well, no, they're in the hotel because they came from a congregate shelter in Far Rockaway, and that's a functioning. There are two shelters, one in Far Rockaway and one in Coney Island, that are functioning, normal, well-run places by Black veterans of social justice. But they were congregate, so in order to deal with the COVID issue, they were put into individual rooms. Trust me, Black veterans would have preferred that the folks would have been closer to where they're set up with hospitals and doctors and everything.
Right.
We're playing like a chess game with people, which is not the way we normally do.
And that's not fair. Right. So I guess my point is how can I help locally while they're here? While they are congregated outside, can I help with resume writing? Can I help? How can I help?
I think we first need, as a community board, to find out to be blunt, just what the hell's going on in each site. I mean, that's the problem, because we're getting this, we're finding this out after people have been moved in by the busload. So we have no way of engaging with it, you know, like at all. And I think that is our goal right now, to get information and to say, like, okay, we're not a NIMBY community, we never have been, but you're pushing us in this direction, because also there's a varying degree of proficiency in the operators. How the Watson is operated right now versus the ones on 36 or 37, it is unbelievable, you know. So, and then there was one notorious operator that operated a hotel for years, which was involved in 3 murders. And they brought that operator into our community again after they agreed to close that operator down. So,
I'm just here to help. I just am trying to figure out how I can help the best.
Thank you very much. I really appreciate that.
You got it.
Our next speaker is Alan Marchetti. Nellie?
And just to answer, Catherine mentioned seeing street homeless. The way that what we do now is we call 311 or go online and fill out a form. I've had to do it as well, but again, even if someone's on the street, they have the right to refuse shelter. So it's kind of a challenge, but I've had to do the same thing.
Well, we do have a very active street outreach team in our district. Before this problem, really working with people who are very resistant and getting them to services and to housing eventually. Alan Marchetti?
Yeah.
Hi, are you able to hear me?
Yes, we got you now.
Hi.
You're on mute. You're on mute for a while.
Yeah, thank you. We live on West 36th Street, and as Brian mentioned, it's been overwhelming in the past 2 weeks. The change in the atmosphere of West 36th Street. Actually, I myself was mugged for the first time in my life, probably by someone living in these shelters, because the person went into the shelter after he did whatever he did. Anyway, my question is, although we all want to help these people, as Ms. Brickman mentioned, on a more local level, how do we increase security in these areas? Because there is a huge difference in the safety of West 36th Street, as Brian mentioned also. How do we increase security in these areas?
Well, I think the first thing is to determine and have direct discussion with HRA, Department of Homeless Services, and each operator. Because when we had that conversation after the fact, of course, on 57th Street with the Watson, we got specific information about the staffing. It was like they were prepared. The prior one, Washington Jefferson, no one knew anything. And it was totally a disaster. So Jesse, our district manager, suggested that we're going to set up a meeting next week with HRA and the operators to say, we now have a huge issue. Probably have to have a weekly meeting to discuss what's going on here, because we have to do, when we had these issues before, we do coordination with the precinct, with the precincts, with the operators, whatever. And remember, this may persist. We may have these folks temporarily relocated for 90 to 120 days. Right. So let's figure out what we're doing here, because we can't have the social fabric just get ripped apart, because we have a huge public health emergency. Mm. And when you fix that, you can't tear apart something else at the same time. You have to balance it back and forth. That's all.
Yeah. Well, most of these shelters, even though it's month to month, have signed up for 6-month leases or whatever the options.
No, they are no. We verified they are month-to-month leases.
All right. So
I asked that question about 7 times with HRA, and I finally got them to say month-to-month.
So is there a way to limit the number in a certain area? Again, I believe someone said there's 518 just on West 36th Street, which is 25%, almost 25% or more of the 2,100. So my concern is safety. It's I can't even walk out without being yelled at, or as I was physically accosted last week. So is there a way of limiting the number of residents on one block?
I think we need to engage with HRA and DHS to say, come up with a plan. You have month-to-month agreements. Let's figure out a way to not overburden one block or another to manage through it, and also deal with the security issues and the social service issues, and bring the providers in. Because like Katie said, the providers aren't so happy about this either. Right. Imagine you have an entire arrangement in Coney Island with all kinds of services set up, and those people are just picked up on a bus and moved to West 36th Street. It makes literally no sense. So,
and so I guess, just to comment on the safety, it would be advisable to get to know your sector cops. We had a police precinct council meeting yesterday. Some of these issues were brought up. The police are aware. I think your precinct might be the 10th. This was Midtown North that was discussing this, but it is important if it's a safety issue in terms of crime, et cetera.
They're in the
Please,
south, Dolores. So, yeah, one of our problems is now we have the 10th, the north, and
south.
Midtown South all involved, and therefore try to coordinate that, right? You know.
Right, yeah, Dolores, the police are more than well aware. They are more than well aware, and I think they're saying, what can they do? I mean, in a short period of time, to have that many residents, to have that increase in population, I don't think the police know what to do. They're also dealing with the riots at the police precinct on 36th Street. So I believe they're very much overwhelmed. I speak with the police every day. They hang out right next to my building. They're all very nice, but they don't have an answer. You know, we need to come up with answers. That's why we're having the meeting here.
So anybody else from the public? I see no other raised hands. Remember, just hit the raised hand button so you can be recognized. Anyone?
There's no one else.
Okay, so I'll entertain a motion, the type of letter we want to write regarding this. Betty, you want to take a stab at it, or Dolores?
Yep, I make a motion that we write a letter, which is much stronger than our previous letter.
Stronger than that one?
Yes, I think unfortunately, it does need to be addressed to the mayor and then, of course, the agencies, because this is a management issue. And I think that obviously all the elected folks need to be included. We need to focus on the issue of the concentration, of the lack of organization, of more importantly, the nonsensical locations that are provided for the operators, and also the lack of notice, not just to the community, but the lack of notice to the operators to move at such a short period of time. And I think that we need to call out in this letter as well, the families that are already here at the Skyline, that increasing the instability of their situation is detrimental, not just on the health level, but detrimental mentally for these families. So we need to focus on that. And also that we would like to find solutions to additional security throughout the district, as we now have an additional 2,100 residents and operators that have varying levels of capabilities.
Very good. Is there a second on that? Second from Betty. Are any of the elected official reps wanting to speak on this? We have Maya Burlow from Senator Hoyleman's office, Matt Keller, and Matt Teig from Gottfried's office, and I think, did we lose, I think we lost Carl Wilson, right? Nellie?
I don't see his name as an attendee anymore.
Okay. Yeah, he told me he had to leave at some point.
Okay.
Anyone? All right, so all those in favor, please raise your hand physically so we can see it. All those opposed? All those present not eligible? Okay, anyone not vote? Kay, did you vote? Yeah. Yes.
I wanted to abstain.
Abstain? Okay.
Yep.
All right, move on to our next item, which is, and then Nellie will bring those folks in. It is 525 West, 517, 525 West 45th Street. This is a building with a long, long history. It is a loft building that was converted to residential, subject to a series of owners, a lot of harassment. Finally, at the end of the day, a cure for harassment. And that cure for harassment is done subject to the inclusionary housing regulations. And it went through this committee, and we reviewed it, we looked at it, and we approved the plans of the cure for harassment and the whole nature of it. I want to note, we have the owners with us tonight too. So Nellie, if you can bring in Ophir and who else? Shai, right?
Yes.
Okay. Is there anyone else from the ownership team?
I have 3 people.
Okay. Great.
Ophir, Shai, and Talia.
Oh yeah, perfect. Okay. And the question tonight is, the community board reviewed and approved a set of plans, and there's a question about the execution of those plans. I will say that we have had zero cooperation from HPD on this. The board district manager has reached out to HPD. I have reached out to HPD directly and asked specifically, send us a copy of the current plan so we can just review it in order to prepare for this meeting tonight. We received not a response whatsoever, except for the director of the inclusionary housing program, who actually wrote to the board, if you want to get information, these will be subject to freedom of information request, which is ridiculous. We get these all the time. We review them. It's part of the public process. It is part of the zoning. And I'm sure the owners, we all have worked together on this. That's what's so crazy. But for HPD to say you can't have information is just nuts. So we're going to hear first from the tenants, and then we will hear from the owners, and we'll hopefully work through this. For the tenants, can you just tell me who will be speaking for the tenants first? Charlotte, Robert, who's going to speak for the tenants?
I guess Charlotte will start.
Okay, thank you. Thank you, Dan.
I just want to introduce, we asked architect Robert Tan, and we provided the board with some information. We understand that there's been another inspection of some sort of the cure units. The building doesn't have a C of O, doesn't have loft board or HPD approval. The original approved plans that you approved had what we believe to be legally required recreation spaces, which were removed. And I'd like to turn that over to Mr. Tan, who can speak to that.
Aye.
And I want to know for the committee members and the public, one of the problems we're having here is that the agreement that's been recorded against the property as part of the cure does not have attached to it the plans as it normally would. Go ahead, Robert.
Aye. Basically, it's in your building is in a preservation for special district, and there is an issue with the open space. So in zoning regulations 1512, it says that this building is not required to have let me say, does not require to have a recreational space as per zoning 1512. But it does say that because it's in a preservation area, special Clinton district, it has to follow those regulations. So that regulation is zoning ZR 9610 and specifically 96102 lot coverage regulations. And that says within the preservation area, the open space requirement of Article 2, Chapter 3, and the lot coverage provision, Section 2411, are not applicable. But the lot coverage provision of this section applies in lieu thereof. Any development containing residential use shall provide a minimum of 20% of the lot area of the zoning lot as usable, landscaped open areas for occupants of dwelling units in the development. So basically, they don't have to do 1512, but they must do 96102. Also, in 9653, conversions to residential use, the building may permit such buildings to be converted to residential use in its entirety, provided that such buildings include social or recreational space, primarily for the use of occupants of the dwelling units or rooming units in the development, which may be also made available to the community. There shall be at least 30 square feet of social and recreational space for each dwelling unit, and a total area of at least 5,000 square feet, whichever is greater. Such spaces may be located outdoors at grade level or any floor level, including the roof area. Now, my recollection of the drawings was that there is a landscaped courtyard on the first floor, but they removed the recreational area on the roof on, I think it's 517. I asked why, and no one could give me an answer except their attorney, Mr. Mandel, did state that because it's in this preservation area, 12 section 1512 is not applicable. But that's true. But then they have to be applicable. Then zoning 96102 and 9653 must be, because that's what's in the preservation area. Does that all make sense?
Unbelievably, yes. So let's start out with anybody else from the before we go to the owners, anyone else from the building want to speak? Any tenant? Okay, then let's go to the owners, and can you just speak first to the question of the plans that have been approved by HPD's building and land development services? Do you have those plans, and can you please forward the final set that was approved?
I think I told somebody of the community that I'll do that when I get to the city, Joe. We need the servers. I need the servers, and I'll get in and I'll send you the plans. But you should have it. Send it 2 years ago.
No, I understand, but we are in the process of moving our offices right now in the middle of this horrible mess. So my question for you though is,
Joe.
Anyone else in your team have access to those plans?
I will be in the city later this week, and I will get you a set of plans. Okay.
Very good. All right. Next week. Next week, you mean?
Next week, yes.
Next week. Okay. So can you speak for a moment to the issue of what was on the approved drawings before we talk about zoning?
Okay. I don't know if you remember this. In 2014, we filed to develop the building, to enlarge.
Oh yeah.
To put HPD units and to put low-income units and mix it up a little bit. And I don't know if you remember this, not only the community, but the tenants shot it down, right? And we ended up, instead of developing the building, we ended up converting the building, okay? Which Robert Tan knows means two different things, okay? Let me just reply to Robert Tan as to what he said up until now.
Okay, I actually want to direct the discussion and not Robert Tan. You're talking to us, the committee. So okay. I want to reframe. You came to the community board, you proposed to do an addition. It was not approved because it was not zoning compliant. You came back to the community board, it made perfect sense, it's fine. And you did a conversion. And you had to do a cure for that conversion. That's the process we work in, right? And we negotiate things back and forth. I have a simple question for you first and foremost. The plans that were reviewed and approved by HPD as part of the harassment cure, was there outdoor space included on those approved plans?
Only
I just don't know.
Only the courtyard. Only the courtyard, not on the roofs.
Okay, all right. So then one of the things, if you remember, we wrote a very lengthy letter about zoning compliance back and forth. So we just want to verify, part of our role here is to verify that which was approved is that which is built.
Okay, so let's talk about zoning compliance, okay? So zoning resolution 1512 does not apply to the special content.
Okay, I'm going to ask you again, not to jump there to begin with. I'm asking you first to speak to the plans that were approved by HPD's inclusionary housing unit. Are those the plans that were built?
Yes.
Okay, so that's a yes. That's good. And once we see those plans, we'll be able to then verify with the building that which they approved, you built. That's the first thing to get off the table. So I'm trying to get clear about this, all right? The next part is a new zoning compliance thing. And by the way, not the first time in the world that the city of New York and HPD misses a zoning compliance issue. So if it's been raised or something, let's just talk about it and see if it applies. So now, can you respond to that issue?
Yes, zoning resolution 1512 does not apply to the special Clinton district. In the first few sentences of the applicability of that chapter, it says it does not apply to the special Clinton district, okay? So that's gone, okay? Zoning resolution 96102, it is true that it talks about open space requirements and so on and so forth, but also doesn't apply because this is not a development, this is a conversion. In the zoning resolution, they mean two different things. If we were to enlarge the building like we did before, that would be a development. Then you would have this recreation space on one of the roof. Now, zoning resolution 9653 does not apply in its entirety, okay? It talks about community facility buildings that are being converted to residential. This is not the case here. It's not relevant to our building. And I don't know even where you got this from, so.
Okay, all right, right. But again, we're having a conversation, right? That's what we're doing.
I'll tell you what the problem is, Joe. I'll tell you what the problem is, okay?
How about we stick to the facts and not get into the problems?
Okay, so these are the facts, that it does not apply and the recreation space is not required, and that's it.
Okay, so.
Now, I have a problem.
Right, but just to note, any of the provisions of 96-10 apply to developments, enlargements, extensions, or conversions, right? And this building is definitely a conversion. So
this building is a conversion, yes.
So there are two issues here. One is you said flat out that any of the rooftop open space was not part of the HPD approved plans. That's an important thing to find out. We have to verify that, and that'll take care of that matter. And the next thing is that the question of open space in 9653 doesn't apply because it's accepted out. Could you speak to that a little clearer as to how that works?
Yeah, I'm gonna read out 9653. For conversions to residential use of a building, predominantly occupied by uses listed in use groups 3, 4, and 5 that exceed the residential floor area. This building has nothing to do with use groups 3, 4, and 5. Okay, this is a manufacturing building being converted under the loft law.
Right.
Residential use. It has nothing to do with community facilities. It has nothing to do with community facilities. That does not apply to this building. Okay. And I also printed out the definition of development as opposed to conversion if you guys want to go over it.
Well, this is a conversion. There's no question here.
So that's that. Now, Joe, that's that. And that's why we don't have a recreation space. We do have a nice courtyard that the tenants use. They're free to use it.
So there was, on those plans, there was never an open space on the roof.
No,
that was presented to us.
not on these plans. The plans that had this were the original plans, or even there were many iterations to the plans. And one of the iterations, it had the recreation space, but it also had an enlargement. It was a development.
Correct. I understand.
So that plan has recreation space on the roof, but it was never built.
That was not the approved plan.
No.
Right. I'm watching Talia go like this. I'm following her face there to understand what's going on here. All right.
Oh, listen, that's been one hell of a ride.
So let me come back then to Robert, just to ask the specific question. When you go to 96-10, which is the basic body of the district, can you give me the citation again so I can look at it? I have the zoning open now.
Me?
Yes, Robert.
Oh, 96-102, 96-10, and then specifically 96-102.
Okay, I'm going to 96-102 right now. Give me a moment, folks. I'm sorry. We are in the world of many.
I have it in front of me. I can read it.
I got it. I got it. We're in the middle of many devices, right? So that's our problem here. Okay, so it says open space of Article 2, Chapter 3, which you noted, and the lot coverage are not applicable. And the lot coverage of this section instead applies. Okay. Yes. And you're not in a C62. You're in an R8. So this really speaks, Robert, to lot coverage in 96. Right.
Right.
And therefore, it says you're exempt from the lot coverage provisions and the open space requirement of Article 2, Chapter 3. So now lead me to your next conclusion.
Well, the conclusion is that basically this area, which is 96-102, let's see, the lot coverage provisions of this section apply in lieu thereof, which is 96-102.
Any 96-102 merely says is that you cannot exceed 70%. I'm very familiar with this particular thing.
Okay.
And therefore, an existing building, this has been interpreted many times that an existing building cannot exceed 70%. It doesn't mean you have to, if a tenement, which is the normal, the standard structure, exceeded, that you would not be required to remove it to comply.
Correct. I understand that.
Right. So where does it, can you tell me where we lead to next, having the requirement for the open space? Because this clearly says the open space requirement does not apply, and in fact, just can't be.
But this section does apply 96-102, where any development containing residential use.
Right. But this is
not community, not community.
Right. But this is not a development. A development is a piece of new construction. This is a conversion.
All right, if you then do the conversion, it would be 9653, conversions to residential use. Conversions to residential use buildings may permit the entire building to be converted, okay? Provided such building includes social or recreational space, primarily for the use of the occupants.
But is it a use group 3, 4, or 5, as Ophira said?
Right. No, it's not. There's no community involvement in it, but it is still a conversion with residential use.
Right, but it's
not primarily a community facility. It says primarily for the use, it can be converted to residential use, provided that such building includes social and recreational space, primarily for the use of the occupants of the dwelling. And now this is interesting, where it says, there shall be at least 30 square feet of social or recreational space for each dwelling unit, or a total of at least 5,000 square feet, whichever is greater.
But again, one more question for you, so I'm clear about it, because I was actually present when this section was written and revised. It says for conversions to residential use of a building, right? Mm-hmm. And then it's comma, predominantly occupied by uses listed in use groups 3, 4, or 5. Okay. So my question is, does this building contain use groups 3, 4, or 5?
I don't know offhand. I don't have that in front of me.
So that's a threshold question, right?
Right.
And this was written specifically for a building for Fountain House done on West 47th Street between 9th and 10th Avenues back in the early mid-'80s. And then it was used again for another building on West 47th Street between 10th and 11th that my organization was involved in. So I am just going to ask you to look a little bit deeper into this to see if there's an applicability, because if there is, then we will work with this owner and HPD on it. If the applicability, this is a very narrow thing. And I know, by the way, on the committee members, this is very complicated stuff. This comes frequently when we deal with these cure for harassment issues. And this building has been particularly thorny. So we want to take our time to understand. And I would appreciate, Ophir, that your reserves of patience come to the fore here, okay? I know you're a very patient, wonderful fellow, right? Exactly. So let's work through it, guys. So we know for a fact now that the lot coverage does not apply in 96-102, but now we're to this conversions to residential use, which clearly this is, but does it apply? And our concern is, if it does for these use groups, then is there something that maybe the City of New York HPD's review missed? We don't know that yet. If you can give us some sort of write-up or something, Robert, that can direct us in other words,
I'll dig in deeper.
Yeah,
I'll do it more details.
So, and the committee is so experienced in this, right? Guys, we spent a lot of time painfully going through things like this. Remember 7th Avenue, the details we went through on this? So it's not a new thing. So we want to make sure that we're being a fair arbiter between the owners and the tenants. And if there's an issue, let us know and we will advocate for it. We need to understand it clearly, otherwise we really can't be informed.
Understood.
So I want to go around the room again before I get to the committee members. Anything else from the tenants, any tenant, or from one of the owners? Anyone? Okay, so let's go. I'm sorry. Anyone? Raise your hand. Just give me an actual hand raise. I can see you. Nobody. All right. So let's go around the room on the, oh, Dolores, yes.
As we are advisory, I'm questioning why in real time we are trying to determine the interpretation of the zoning. And obviously, when the community comes to us, it's very important that we help navigate, and I appreciate that the owner also is working through this. But honestly, I think that these types of questions are better served offline because we don't have enough answers. And I'm not quite sure as a committee what we are supposed to be opining on this evening, considering there's still work to be done in that interpretation.
One of our problems is, Dolores, if we had gotten the plans from HPD as we have requested for the past 3 months, we would have had all of this due diligence done prior. We have been hobbled by not having these plans in hand and getting a bizarre response saying, do a freedom of information request for something that they came and presented with the owner to us. I mean, they directed the, right, Ophir, HPD directed you to us. It's not like we didn't all work together on this.
No, I don't like, Joe, there is no issue here. You know, it's
No,
not,
but I'm saying it's very crazy that HPD would not say, here, take our information.
why? That's the HPD.
You know, so we're kind of
But
hobbled.
Joe, my question is what are we as a committee for this particular presentation? What are we working on at the moment?
We actually end up doing fact finding because we have postponed this for 3 months in a row, hoping we're going to have the information to be able to come fully prepared. So instead, we decided let's use basically a fact finding discussion.
Understood.
We felt very bad that we were not responding to either the owner or the tenants without the information.
Okay, so we're not looking to make any recommendations at this time on this issue. We're just trying to bring the parties together to get.
Well, I think we've narrowed it down to a question to the tenant's architect to give us some information, and then we can decide whether or not we act based upon that.
Great.
And also, Ophir's going to get us the plan, so I want to put the issues to bed one at a time. You can't. It's too messy without taking them one at a time. Any thoughts from other committee members? Josephine? No? Leslie, any thoughts? Paul? Committee members first up here.
No, I agree with what was said by Dolores. I think that's the way we should go.
Okay. Martin?
Did the owner plan to preserve the courtyard?
Yes.
Well, what the hell? We're finished. It's putting down paperwork.
No, I think the building doesn't have its final sign off by HPD at this point. They're working through that.
Then
This has been a long road, Martin. This is I got involved with this building in 1981.
2014. This is the last round.
Yes, it's the last round. There's no question. Go to James. Any questions? Pete? Hector?
Yeah, just a little clarity here. So maybe I'm interpreting this wrong, but are we saying the courtyard kind of fits the original authorized space that's supposed to be for the residents, and the residents are saying that no, some sort of roof deck or some sort of other accommodation was supposed to be created as per the agreement, or because it sounds, that's what I'm getting from this.
There would normally be a set of approved plans reviewed and approved by HPD saying what's going to get built. Once we get that in hand, we're going to find out whether or not, as the owner represented, there is no rooftop work that was on the prior iteration of it. And that means only what HPD approved is what we can hold the owner to deliver. So, and then we have the new zoning issue, which it's not the first time HPD's approved something and they don't get the nuances of the zoning. So it makes sense to go through this, get the due diligence, and really understand it.
Gotcha. So we're waiting for the plans for the owner to provide you, hopefully by next week, so we can get more clarity on this. Is that what
And
we're
also
doing?
the architects will give us some information about the section of the zoning.
Gotcha. Okay. Thank you.
Katie, any thoughts?
No, not at this time.
Okay. Dolores, anything
Joe,
fun?
I have a question.
Yes, Maria, sorry.
a side question, not directly about this, but wondering about HPD and why they would not be cooperative. I don't understand.
I find it remarkable that the director of the inclusionary housing program actually wrote back to the Jesse saying, we don't have to provide this to you. When that program on a regular basis brings both inclusionary plans and cure plans, and in this committee, we've all sat and we've reviewed them, right, Betty? Multiple times, many times. And the developer always comes with the HPD sitting there, and that happened in this case. So this is, I think there's no institutional memory. It's like there's somebody who's there now, who's a director who's never done this before. Betty, I missed you, sorry. Betty?
Where's Betty?
I think it'd be worth another try at HPD, even if the owner says he's going to give you the plan this next week or something. And there must be somebody over, somebody over who has more authority over the guy who says, you know, go foil it. I mean, that is the most absurd answer to give you or to give Jesse. So I think you should give it another shot.
I actually wrote him a very nice response saying, maybe you're not aware that your division has come to our committee on multiple occasions with plans, with information, like, you know, and radio silence for 2 weeks.
Then maybe the sweet talk isn't working. So anyway, that's what I think. I think
Any less words from either tenants, from Robert or Charlotte, or owner Ophir?
Joe, I see Pete raising his hand.
Oh, sorry, Pete, go ahead.
Just a question here. I think we have some new members that have very little knowledge about the cure or the process. And that might be a reason why you're not getting any questions from them.
So in a building where there's been a finding of harassment, or where there's an incipient finding, under the special district zoning in the Clinton Special District, in Hudson Yards, and in West Chelsea, and in the Garment Center, in between 8th and 9th Avenues, an owner must, to cure the harassment, provide 28% of the floor area of the building to be developed or renovated as permanently affordable housing, subject to a series of very specific regulations. And that cure process is run through the inclusionary housing division and through the inclusionary housing department. So it is a highly regulated process. Owners come with plans, with budgets. There's a full application. It's referred to the community board. We have 45 days to comment on it. And in many cases, like this one that was very contentious, this went on for a number of months before we came to an agreement on it, with HPD present every step of the way. So that's why it's rather disappointing. We asked HPD and it's as if they don't exist right now. So it is a charter mandated process through the zoning resolution that the community board comments on these cure applications. Does that help for everybody?
Yeah, thank you.
Yeah. All right, I think we're done with, oh, sorry, Ophir, yes.
I would like to make it clear to everybody here that we did not harass anybody. This was done by prior ownerships and we have nothing.
Oh, no, of course, yeah.
That's first.
So,
second, I would appreciate that before you guys send out these, Robert Tan sends out letters to everybody, also to get a copy, okay? Of what
of
he's
course.
talking about.
Mr. Chan will send it to Jesse Bodine at the community board, and then we'll distribute it to everybody at this meeting.
Okay.
Also, remember, for everybody, this is important for the new committee members. When we talk about harassment, the specific issue is the harassment traveled with the property. So we always want to make sure that if there's owner A who sells it to owner B, someone can't say, oh, dirty hands, clean hands, I don't do anything. It sticks with the property. Everything that happened here was prior, and then these owners purchased the property with those actions on it already. And that's the case in every applicant that we get when we do a cure for harassment. It's very rarely the people who did the harassing that end up curing the harassment. Is that fair, Ophir?
Yes.
Yes, Pete?
The period, how long, how many years? 19?
No, the period is back to 1973 when the district is established. or 2005 when the other ones were established, Hudson Yards, West Chelsea, and Garment Center. And they look back 15 years, but if anything happened beforehand, it is automatically back to the start of the district. It is not a limit at all.
Yeah. That's important for the members to know. Yeah.
Right.
And Joe,
Okay.
I don't know if you,
Yes.
there's somebody named Charlotte who would like to speak from the Tenants Association.
Oh, yes. Go ahead, Charlotte.
Yeah.
Unmute, Charlotte. Charlotte. Yes, you got it.
Oh, sorry. That in the prior approved plans that went through the DOB and the loft board, these areas were not only included, but the owner's architect, Knickie Bernstein, which is not here on this call, put in writing to the head of the loft board that they agreed with Mr. Tan's assessment that these open space areas that had been described in the approved plans were required. The reason that this has become important, not only to us, but other tenants in the building, is the number of new market rate tenants who occupy the building, although there is no certificate of occupancy. Those units have been occupied since 2018, according to Mr. Naeem and sworn testimony. All of those tenants have access to the roof of the building, which has not been secured in any way or repaired or replaced. And so it has become a de facto recreation area for, Mr. Naeem can give you the exact number. I believe it's 29 new units, which are occupied without a C of O. And so our issue is one of safety, one of privacy. The building was broken into. All of the tenants were burglarized by going up onto this unsecured area, getting into an open, unlocked elevator. And this is one of many instances. That is why the tenants are concerned that this has been removed from the plans.
So I think we need to know for the committee members, this is a hybrid building. It is not just a cure for harassment building. It's subject to loft board rules with conversion. So additionally, if there are specific rules that the loft board agreed with, we had a lot of problems during the cure, loft board and HPD not talking to each other. If you could provide us also, Charlotte, with what you just mentioned, the loft board's agreement on plans and zoning, that would be very helpful too. Because it is not, we know this building is not simple at all.
We would note that we did file a FOIL request for the documents, which perhaps Mr. Naeem has, with HPD for the 4 cure units. There are only 4, which are existing loft tenants. And HPD has not, over a period of many, many months, provided those pursuant to a FOIL request either.
Thank you. But can you give us any information you have about this specific thing about the loft board and the zoning? Okay.
Yes.
And again, I think because we're sort of hamstrung here with COVID and the lack of responsiveness from HPD, I think we need to just get information here to keep. Listen, this is not over till it's over, and we're in the home stretch, but it's not quite done. Thank you, Charlotte.
Thank you.
Anybody else? Okay, so let's move on to our next matter. So thank you very much for attending, and we'll get back to you guys. Thank you very much.
Thank you.
So Nell, if you can take these folks out and put the next group in.
Yes, I'm doing that right now. If the next folks can just raise their hands so that I know who I am moving over, that would be great. Okay.
I think you can take Talia out, right?
Yes, I moved Joshua over. Talia, move. Ben, I moved over. I see Matt. So.
Anyone else from the 49th Street team? Joshua, Ben, Matt, Russ Kibler. Okay.
Yes, that's who I've moved over. Is there anyone else?
That's correct.
Okay. So this is a different matter entirely. This is a group of 14 buildings on West 49th Street between 8th and 9th Avenues that is now subject it was acquired in the private market for market rate purposes. It has rent stabilized units and market rate units. And the owner is seeking an Article 11 tax exemption with a value, Russ, is it 28 million? Is that correct? You can't hear you.
The value of the tax exemption?
Yeah.
I don't think we have an exact value of the tax exemption.
Yes, you have an application that noted the approximate value of the tax exemption.
Right, we can give you the value based on the HPD model.
Right. What is that?
Which comes out to about 20 million.
Yeah, I think it's 28, isn't it?
Okay. I don't recall seeing 28. The model moves around as they adjust it.
I'm just dealing with your model that you gave us, so we'll work on that, but we'll get the information before I write a letter. In exchange for the tax exemption, the owner is not only preserving a series of rent stabilized units, but also taking certain market units and returning them to rent stabilization for a period of 40 years at a bunch of different AMI levels. So Nellie, we'll put up where's Nellie? There you are. We'll put up the presentation, and then are you making it, Russ? Why don't you all introduce yourselves first as to your roles?
Okay. Hey everyone. I'm Josh Gottlieb. I'll be doing the presentation tonight. I'm also the founder of Black Spruce Management and the general partner of this ownership group. Matt Keller is my colleague. He's my business partner. We work every day together, and he helps run Black Spruce. Russ is our counsel who's helped us navigate the world of HPD and affordable housing for the last few years. And that's our team that's here with us now. Oh, Ben Kleinbaum's here as well. He works at Capolino. He's helped us just get through some of the city council issues and everything like that.
Okay, so if we can, Nellie, if you can take this into full screen.
And I'll do my best to get through the presentation as quickly as we can. First of all, thank you for your time and your consideration. We know it's a crazy time in the world. We understand how little time there is to cover everything, so we really do appreciate it. What we're going to walk you through tonight. Can I start, Joe? Is that all right?
Yeah, I want Nellie to pull it to full screen, though. Okay. On the bottom, yeah. Nellie?
I'm trying to figure out how to do that. I'm sorry.
On the very bottom of the PowerPoint, next to the open book.
Sorry.
The symbol next to the open book.
The one to the right, I believe.
Yeah, to the right of the open book. One more. That's it. Yep. No, you had it there.
Oh, this one?
Yep, that's it.
Right
yep.
there.
Yep.
Sorry.
There you go. No problem.
Okay. All right. So, thank you again. What we're going to do tonight is walk you through a few slides that will briefly introduce you to our firm, provide an overview of the West 49th Street property that we're asking for your consideration to approve for in Article 11, and to discuss some of the proposed effects, benefits that the Article 11 will have. At the end, we'd be happy to answer any questions that you have and address any concerns. So we can get started. It's next slide, Nellie, please.
Just page down, Nellie. That'll do it.
No, it's not doing it for me now. Sorry. Okay.
There you go.
Perfect. Okay, I'll try to do this part as brief as I can. Black Spruce, I started Black Spruce in 2009. We invest, develop, we manage residential with some commercial properties, but mostly residential buildings throughout New York City. Our focus always has been, since we started, purchasing distressed and mismanaged properties, situations where we felt we had some value add, and it could be from operational management or just, because the previous owner financed something irresponsibly, and we were able to come in and clean that up. Having done this now for about 11 years, we understand very well how to operate rent-regulated assets. And really over the last 3 years, I'd say, we've made a big shift and really tried to focus our existing portfolio and the new assets that we've purchased and to convert them over to long-term affordable housing. You know, we really believe that there's a lot of benefits that affordable housing, especially existing buildings that you put in Article 11, what it brings to a community. And our goal is to put, you know, these larger portfolios into these long-term plans with the city, with HPD, and be long-term owners and operators of these assets. It's not something that we plan on just, you know, doing and then selling off. To date, we have put 854 units under Article 11, some 30, some 40-year agreements. So we have some experience working our way through that. Just the next slide, please. Just a little bit more about us, just so you understand us better. We like to share our guiding principles. So we have very disciplined financial management. We are definitely hands-on owners and operators. We don't outsource anything or any of our efforts to third-party property managers. We've aligned our business interests and how we invest with our social responsibility. We always improve the conditions. If it's the public areas, the street fronts, you know, you'll never see a ton of trash for many days in a row. And things happen here and there at any of our properties, and we never have a property that consistently has a high violation count. We're always keeping that very, very clean. And lastly, we have direct access, communication, and cooperation with our tenants, city representatives, any city agencies, employees at the properties, the people that invest with us. We're here working with the community board. We're very transparent, open, and open to feedback in any way that we can. And again, going back to how we're so hands-on, we do that because, again, we want to be long-term owners. We want to know our tenants. We want to know the communities that we work in, and we want to know everything at a detailed level. So that's really very important to us. Next slide, please. The proposed property that we're coming to you with, this project, is on West 49th Street, as Joe mentioned, between 8th and 9th Avenue. It's 14 buildings that we acquired back in July of 2016. There's 272 apartments, 6 stores. 58% of the units are receiving more or less what I would consider market-oriented rents, so more or less market rents. Just, you know, you can see some of the renovations we've done on the side. I don't know if you've walked up and down 49th Street across from Worldwide Plaza, but it's a clean block. It's a nice block. We take a lot of pride and effort into managing it well.
Those are not regulated units, correct? The 58%?
So some of the market rate units, some of the market oriented units are rent stabilized, as we discussed in previous discussions. And those also, which I'll get into one of the next 2 slides, those will be receiving a rollback in rents on a forward basis.
So I think the phrase for the committee is a little confusing, market oriented. If you can just, as we go through it, and then give us clear information, how many units are market rate as opposed to rent stabilized? That's the kind of information we would put in the letter about this.
Okay.
All right.
No problem. Do you want that number now?
No, it's fine. We're going to ask questions for you. It's okay.
Okay, so next slide, please. Yeah, this is just a quick aerial view so you can get the scale of the project. It's, you know, a good portion of the block between 8th and 9th Avenue, which would go into this long-term agreement. Next slide, please. Okay. So here, if the Article 11 were to happen, here are, you know, what we consider the benefits, the effects. You know, it's a long-term agreement. It's 40 years. That's, you know, in our view, I guess, a very long time, a lifetime, however you want to put it. And we're fine with that. We're happy about that. You know, if there's ever a big change in zoning, we'd still stay affordable. The buildings would still stay as they are. I think that's important to neighborhood, to look at the neighborhood. So we just wanted to outline that. There'd be rent roll reduction. So the annual rent would be reduced by $758,000. I would say approximately, that's a pretty exact number, across 68% of the units. So on a going forward basis, and that goes back to the market-oriented rent stabilized units, Joe, a lot of rents, both stabilized and free markets, would be rolling back down, not just being stabilized forever. We've also offered aging in place, which is bathroom and kitchen renovations for those who have requested it. We're going to be taking 54% of our current free market units and converting them to rent stabilized. We're going to have rent restrictions. So, the availability is going to be tied to income restrictions. And, we think this is something new, and maybe Joe's seen it done before, but we've come up with a plan that we're trying to implement, and we're going through the final details, and we'll absolutely share it with you. But we plan on forgiving arrears for those financially impacted due to COVID-19 for March, April, and May. The exact details of how we're doing that, and I'm not just saying that so that, we say we're going to do it and then we couldn't figure it out. We're going to figure it out now. But, if people can come to us and we're going to call them and say, look, how are you impacted? Why weren't you able to pay rent? And it's because they lost their job or they had to care for a loved one or something along those lines. We're going to forgive their arrears. It's a one-time thing. We can't do that forever on an ongoing basis, but we just feel that that's the right thing to do right now and that people need it. People have lost their jobs and it can be very helpful to the community and to the tenants of this building in particular. Next slide, please. Additionally, we'll be doing work at the building due to the Article 11 or with the Article 11. Some of it's, I can go through pretty detailed and quickly, but we're going to scrape and paint some of the interior stairwells. We're going to replace or redo some fire escapes, repoint and repaint the facade, improve energy efficiency, and continue doing hallway work. And upon vacancy, and I think this is the most important thing, we are going to upgrade units, continue to upgrade units as needed, consistent with our prior renovations. And, we're going to have a capital plan so that every year or every month as units turn, they get work done. So people moving into these affordable units aren't moving into 25, 30-year-old bathrooms or kitchens or old floors. It's going to be a nice unit similar to our market rate units. We feel like that's the right thing to do. Next slide, please. So just these are some examples of buildings that we've put into an Article 11. I won't spend too much time in them, but the one all the way to the left is a 21 building package that we bought in Central Harlem. That was financial distress, poor management. We bought that in December of 2018. We put it into an Article 11 in June of 2019. Building to the right, those were 9 buildings in Washington Heights with approximately 450 units. In the first 3 months there, we worked with Councilmember Idanis Rodriguez. We removed approximately 700 violations, took buildings out of AEP. That was an absolute nightmare. We put that into an Article 11 as well in June 2019, and we've met with the council member. We work well with the community, and they're very happy to have us up there. And last is a project we own, Montauk Senior Housing in Queens. That's not as much as a lift, but that was the first Article 11 we did that really got us familiar with the program. We've always had very high REACT scores there. It's project-based Section 8 property. And again, work with the council members and tenant association, and we've never had any complaints or problems at that property. In conclusion, we feel that we're good operators. We try our best to do what's right by everyone involved in our buildings. I was born and raised in New York City. I grew up in Lower East Side. Matt grew up in Greenwich Village. We live in the city. We're not leaving the city. It's important to us. And we really believe in what we're doing. And we hope that you guys can as well and approve the project. And if there's any other information you'd like from us or you need from us, we'd be happy to give it over. And thank you for your time and consideration.
Can Ellie take down the presentation? Okay, so a couple questions first, and I'll go around the room for the committee members. The aging in place, the kitchen and bathroom renovation, can you quantify that and tell us specifically how tenants opt into it? Is it reviewed? What is HPD's role? How does that happen?
I'm going to try my best to answer that, but Matt, if I get it wrong, please jump in. Surveys will be sent out tenants have a right to then respond to them and request for it. HPD, all those surveys go back to HPD. They don't come to us. HPD then tells us, this tenant requested it, that tenant requested it. You have to go ahead and do the work. But we agree in our reg agreement to do that work.
And when does that happen in the process?
Have we already sent the aging in place surveys?
The surveys were already distributed in March. And as part of the regulatory agreement, typically we have 6 to 12 months to complete the work outlined.
And how many tenants have responded so far, Matt, for that?
We have 3 tenants respond with requests.
Okay. So I guess we would probably, working with housing conservation coordinators, ask them to work with any tenants in the building to understand. March was probably not the best month to think about the future. You know what I mean? And
it was sent out pre-coronavirus, pre-COVID.
Joe, I agree with you, Joe. We'd be open to.
Right. I mean, I understand just that it's
we'd be open to resubmitting to everyone. Having people explain to them what it means and giving them the opportunity. We absolutely agree that March was a funky time to ask people if they want.
Right. And again, if you're talking about people aging in place, if it's not clear as to what it means on rent, is there an issue, whatever it is. So we could work with our local housing advocacy group to work with you to make that, just to make sure that all the bases are covered on it. Okay.
That's absolutely fair.
Okay. The exact number of units converted to rent stabilized are?
I have it right here. I apologize. We are going from 50.
May I chime in? We're going from 54 to 25, which is a reduction of 29 free market units.
So 29 moving from market to rent state.
Free market to rent state, yep.
Okay. The question of units getting upgraded upon vacancy, what's the compliance on that? How is that reviewed? They evolve. What happens with that?
It's really not an HPD thing. A number of units, as we've discussed, number of units throughout the building have had work different times, different places. So some units may require a lot less than others. This wasn't a request from HPD. It's just, we have a capital project plan, I guess.
But is it embodied in the regulatory agreement?
No.
No. So I know you want to do it, but where's there?
Well, we have been doing it, and we plan on continuing in that manner.
Right, but the regulatory agreements normally lay out the path of how things get done and then get complied with. So I guess we're going to ask that question of you and of HPD on this. We appreciate your efforts, but now we're talking about a regulated environment, right?
Yes.
I mean, the bottom line is Black Spruce leaves 5 years from now for whatever reason. There's a change in the world or finances. And how do we know that your solid intents and your track record is then taken over by the successor in interest? We don't. So we want to figure out ways to embody things like this to make sure.
Agreed. I mean, I believe, and again, this would be more of a Russ Kivler question. I don't know the answer to this, the nuances of the regulatory agreement, but I believe that the units have to be beyond habitable as part of the reg agreement, right? We can't just kind of slap on them.
Right, but that isn't a quantifiable. That's not quantifiable.
But Joe, I don't think it would be an issue. Joe, I don't think it would be an issue to say in the regulatory agreement that upon turnover, that upgrades will be needed.
Yeah, in other words, consistent with whatever whatever it is, Russ, in a way that we're clear that what they've been doing happens, because we've seen many cases where there's a great group that's here, and then for whatever reasons, there's a dispute among partners or whatever, things change, and all of a sudden the world changes. So, okay. Can you tell us a little bit of how the tenants are chosen for the units that are going to get the rent rollbacks?
Well, so the next tenant will be an applicant that would go through Housing Connect.
No, I'm talking about, you said you're rolling back rents now.
No, what we're providing arrears forgiveness immediately. The rent rollback will happen upon the next tenant So one tenant leaving, when the next tenant moves in, that rent gets rolled back.
So in a unit that's occupied today, and it's now capped at a certain rent of AMI, it actually stays at a higher rent until it's vacant?
Until it's vacated, correct.
Right. That's right. And based on the historic turnover data for this particular set of buildings, which is turning about 30% a year, we have projections.
It's actually higher. I think it's closer to 40, right? Matt, is that correct?
Yes, 40.
So
40% turnover of your market rate units, not your rent stabilized units.
No, the rent, that's why I was trying to call it market oriented. I think it's an important thing here. It's that there's a lot of higher rent stabilized units that turn similar to a free market apartment. So that's why I bucketed them into market oriented. Otherwise it gets kind of confusing.
Well, it's a little bit of a confusing bucket because it's not a term that's used anywhere.
And
it's not used in a regulatory agreement anywhere. So I guess the question I have as we go through this a little bit is that tenant A is paying $2,600 or something, or $2,200, right? And that unit is now capped at 80% of AMI, and the rent would have been much lower. But that rent stays in place until that tenant moves.
Correct.
But if that tenant doesn't move for 5 or 10 years, you still get the benefit of the tax exemption, although the unit's paying higher than the rent affordable to that AMI band.
Correct.
That's right. You get the benefit of the tax exemption, Joe, but the shelter rent payment is based on the gross revenue. So the higher the revenue of the building, the more taxes that'll be paid.
Oh, so let me put that in English for everybody, okay? What they're saying is that there's a calculation on the abatement that if there's actually more rent being paid here, they pay more taxes. Is that the English version, Russ? Yes? Yes.
Yeah.
Okay. Right. We're going to need to articulate that clearly because it was not apparent at first go. Okay. So, and your historical issues of 30 to 40% turnover, I've just never seen that in the building before.
All of our market rate paying tenants across all of our buildings in New York City, we have assets in Chelsea, Nolita, Brooklyn. We span a lot of areas. That is actually kind of, if you look at market data, that is the turnover of market rate apartments in New York City annually.
Right, but they're normally not rent stabilized units. People tend not to move out at even higher rent stabilized units in New York City. That's what I find kind of interesting. Market rate units, people move all the time.
I'll tell you, I'd be the happiest person in the world if nobody ever left. Unfortunately, that's not what happens here.
So can you talk to us a bit about the AMIs? Because you expressed them in AMIs, but not in actual income bands. So Nellie, put that back up on the screen for a second, and then Joshua can speak to what are the actual incomes attached to the AMIs.
Matt, can you take this one, please?
Okay, give me 1 second to pull up the presentation.
Matt?
Yeah, Matt,
I think he's frozen.
There you go. It's not, I've got it right here. So the rents are capped at the AMI levels that were set forth on the presentation. There is, Joe, an income band. So for a 30% unit.
Right. I just want Nellie to put it on the screen so people can see it in relation income band. There we go. The slide, Nellie, with the various income bands. Yeah, that one. Right. Full screen.
Hold on.
Bottom next to the book.
Yes, my screen just froze. Hold on.
Of course. Welcome to the lovely world of Zoom, guys. There we go. Perfect.
Okay.
So Russ, if you can just tell us for the 30% AMI, what's that? What are those in dollars?
To the right, you've got 30% of AMI. The rent is capped at 30% of AMI, but that unit can be leased to someone who earns up to 40% of AMI.
Correct. So give us the committee members are familiar with the flexibility in the bands, but give us the actual incomes that it serves. the range?
I'll have to pull that up. So it's 10% on each tier, with the exception of the 110s, which can go up to 125.
No,
If you give
Russ,
me
I
a-
think they want to know how much does a 30% AMI one bedroom rent for?
Sure. hold
Rent
on, I'll
for,
pull
but also income.
And how much income is someone at 30% of AMI?
Yes, exactly.
pull up the schedule so I give you the current exact data on that.
If Matt's here, he'd have that.
Is Matt on? He was frozen a moment ago. Is he here?
Here, I have it pulled up,
Good.
Russ, and you can jump in if you need to. But so for a family of 3 at 30% AMI, the income is $30,720.
The maximum.
Maximum. For 50% of AMI for a family of 3, it's $56,850. For 80% of AMI for a family of 3, sorry. Oh wait, I'm sorry. For 50% of AMI for family of 3 is $51,200. 80% of AMI for a family of 3 is $81,920. 100% for a family of 3 is $102,400, and then 110% of AMI for a family of 3 is $112,640.
But those go up to 125, right?
Right. And 125, it's about $127,000.
Okay.
So it's a good range of income. It's a mixed income building, which is.
So we're really talking about, and then for a single person, for the 30% of AMI, what is that, about 26?
$23,880.
So we're talking about serving households from 23,000 up to 125,000 approximately, right, Russ?
That's correct.
Broadly, okay. Nellie, take that down. I just want to make sure people understood there's a broad range of incomes here. And the last thing, if you can note, because we didn't see anything on it clearly, we talked again. You have a marketing agent, right? And that marketing agent is your partnership. Is the partnership, correct?
Correct.
And we not clear about though is when applicants will be able to apply for this type of building, because the last thing we want to see is go through this whole process and there is no community access to these buildings as you have your 30 or 40% turnover. So explain how that works.
Well, right now the process is it goes through Housing Connect. We've discussed community preference, and as we discussed on previous calls, we'd be incredibly happy to have a community preference. We just need the community board's help enacting that and making sure it can happen. From our discussions at HPD, it seems like it's kind of considered a troubling issue, but we're happy to work with CB4, and we're happy to work with you. However, any direction you can give us at HPD and any projects that you've had, the ability to have community preference, we'd be happy to take it to them. And
that would be our last 30, 80, 20s.
Yeah. So, but on existing projects, they seem to say that falls under something different. But again, we're being told one thing. It seems like you're being told another.
Yes.
But they said on new construction, there's community preference. On existing buildings in place, there isn't. But if you can direct us to someone.
Yes. We have a troubled supportive housing building that we all know very well, 330, 332 West 51st Street. And it was a renovation and there was community preference. Period.
There's absolutely no pushback from us.
Okay. So, but let me give you the broader question though is when it's a lottery, when does that get issued? What's the time frame? Describe that a bit to the committee members.
Over the last few projects we've done with them, as especially they were trying to get up this the new website and the new way that they're going to do it, Housing Connect 2.0. It's been a 2 or 3 month process to get all the marketing materials in place. Then they get it up, they run the lottery, then they start seeing who's eligible. And, it's taken quite some time. I would say that the first round of units coming to market and being available for anyone is probably 90 days out.
90 days from the grant of the Article 11?
Correct.
Doesn't that seem kind of optimistic?
Yeah, I mean, they look, based on our conversations that we've been having with them, now that Housing Connect 2.0 is up, they seem to say it's going to be a more streamlined process, and that's what they've been working towards, and it's going to be great.
I just smile in your direction, that's all.
I'm smiling back.
They announced it yesterday.
I know.
Like 2.0.
Well, yeah, but we've kind of been watching the rollout happen on some of our other projects. Look, 90 days is optimistic. I'm trying to remain optimistic, all things considered at this point. But that's it's not going to be sooner than that.
Would you like to work with HRA and get some hotels settled too? Yeah, it's very easy. This is not like the best. The management skill is not the highest moment right now, we could say. All right, so I think I've gone through the basic information the developers presented. It's a lot of information to absorb. We've had these before. This is similar to 3, Maria, what's the address on 53rd? 326, 328, right? 326, 328 West 53rd Street we saw, and then 424 West 48th Street is in that same package, where an owner, in those cases, those were Section 8, these are not Section 8, comes to specifically get a tax exemption in order to make the buildings more financially viable. In this case, these owners paid quite a high price for them, and to make this all work, given our current market, they're going and agreeing to 40 years of affordability and putting many more units in rent stabilization. And again, I think everyone appreciates your COVID-19 stuff there. That's great. So questions from the committee on a very complex thing. Let's start out with Betty, who's seen these before, so she can ask a lot of good questions.
Unmute. Well, the first question is, you said it's a 40-year term, so that means that the rent stabilized units, whether new or old, after 40 years are no longer under rent stabilization?
My understanding.
Sorry, go ahead, Josh, if you want to.
My understanding is that if this were to burn off today, they'd remain in rent stabilization. Having said that, on a going forward basis, 40 years from now, as of today's laws, that I think that's where you'd end up. They would remain rent stabilized.
The current units will have to stay rent stabilized because they are. It's the income restriction being put on top of it. I guess Betty's crux of the question is the ones you are voluntarily putting in rent stabilization. Does the regulatory agreement allow you to take them out?
They come out of, when the regulatory agreement expires in 40 years, all the units remain subject to rent stabilization until they're vacated. So the earliest point after 40 years at which a unit can come out of rent stabilization is when the tenant that was living there when the regulatory agreement expires moves out.
But no, Russ, how do the units that were already rent stabilized come out of rent stabilization? That doesn't make any sense.
That's right. For the new units.
No, this is only about the 54, right?
The current units that are rent stabilized will remain
29. Right, the current units that are rent stabilized remain rent stabilized.
Will remain rent stabilized unless the laws surrounding rent stabilization are changing it.
Right, but the 29 at the end of the grant, at the end of the term of the 40 years, do those stay in rent stabilization by virtue of the regulatory agreement, or do they? Is there an out via the regulatory agreement?
They can come out of rent stabilization when the tenant that's living there at the time the regulatory agreement expires moves out. So in other words, it's not a hard stop, 40 years, you're out of rent stabilization. The tenants that is there at that point continues to get the protection of rent stabilization law.
Okay, so that's going to raise a question. Betty, go ahead.
Let me just see if I understood the last answer. That if a person is in a rent stabilized unit in the 29 new ones, and the 40-year term is up, and they are still in that unit, then they are still covered by rent stabilization, correct?
Correct.
But if they leave before rent stabilization 40-year term is up, if they leave, the unit is no longer rent stabilized.
No. If they leave after the term is up,
But what if they leave before the term is up?
it stays stabilized.
It's
Oh,
stabilized.
it stays that way. Okay. All right. I'm going to pass to the next person now.
Okay, Paul.
There we go. Yeah, just one thing, one quick question. I remember when Murat Plaza was an empty lot with one building on the corner with pigeons in it, but I don't remember after it was built. Maybe you can fill us in. What was the deal for that row of buildings? As I recall, it was part of the massive Zeckendorf negotiation, and those tenants were preserved. Was there a structure in the beginning that has been changed? What I'm going towards is that large number of, what was it, 120 units and 110% of AMI. Is that a change over time?
No, Paul.
Yeah.
These buildings were known as the Dr. Lerick buildings.
Yeah.
They were a long-term owner who had lots of problems.
Ah.
The buildings you're referring to are further down the block west, on the corner and into the block on 9th Avenue, around on 48th. They were part of the Zeckendorf package, and those are owned by the group called CARE, Clinton Association for Renewed Environment. Those are permanently affordable. These are not those buildings.
These are not. All right. Well, that was my big question. Is there? It seems the 110% of AMI vastly outnumbers the other. The total for all the other income groups is roughly what? I'm sorry, I didn't take a note of it when it was up there. Is it roughly about half of it? A third?
Josh?
Yeah, I'm doing it. 28, 38. It's approximately 80 units are in the other bands.
Well, 80. All right. Well, that was my main question. Sounds like it's a plan. I've never heard one quite like it. I'm tending to lean in favor of anything that puts some more affordable housing anywhere in our board area. I congratulate you on coming up with something I've never seen before. I'm very interested in it. I hope we can work it out. Thank you.
Thank you.
Josephine?
So I just wanted to clarify, of the 272 units, how many are rent stabilized units?
Today.
213.
Okay.
5 rent controlled, and then the remaining 54 are free market.
So my big issue with this is that, as everyone knows, that we are in a budget crisis in the city. And, all across the board, everything's being cut, right? $800 million to education. And we're asking the city to let go of revenue, because the only revenue that's coming in is our taxes, our real estate taxes. So I just want to be very mindful of the decisions that we make going forward, because it reverberates throughout basically every industry. So I just want to put that out there.
I think it's important to remember that every time we have any affordable housing proposal, it always comes to the tax exemption, for the simple reason that the restricted rents cannot carry full taxes and a mortgage. It doesn't work. So this developer purchased the buildings for 95 million, correct?
110.
110 million, better yet. So they purchased them on the event that, in fact, they could turn over more units and create more market rate units here over a period of time. The world has changed and the market was slowing down. The solution here is to go to the city for relief. And the city, when they go for relief, they say, in exchange, you must do affordability. And our goal in this discussion is realizing that the equation is never perfect. And then we throw COVID on top, right? Which makes it even crazier in general. But every affordable housing development that we've dealt with for the past 40 years has a tax exemption connected to it. One of our roles is to make sure that we get enough benefit for the exemption that is being granted. Right. And that's why we spent a lot of discussion about what this means. And, like the question about the upgrading and Betty's question about the term, we want to make sure that we're getting something. And then also, very important, access, that our community members have access to something. This developer has been told by HPD there is no community preference because the buildings are there. Excuse me? Really? So we have to work through that. And it is subject to approval by the city council, and that's why they've come to us, and we have to put conditions on it to make sure that the council member, the speaker of the city council, as Dolores mentioned before, has requirements for their approval of this tax exemption with HPD.
So you're saying that the lottery would be exclusive to CB4, is that what you're saying?
No, normally any lotteries have a 50% community preference. That's standard. This developer has been told there would be no community preference in the lottery. That's not acceptable to us. I know that I know this committee. They would be like out of their minds on that one. So
that's it.
Okay, Leslie.
Yeah, I just have a quick question about services provided to the tenants in the buildings. What kind of services? Is there on-site super? What are the services provided to tenants in that structure?
There's an on-site super. We actually also have a on-site property manager who's there every single day. A number of porters and handymen as well. I don't have this staff list in front of me, but there's, like I said, on-site super, on-site property manager.
And remember, these are 14 separate walk-ups, correct?
Yeah, so it's kind of hard to create like any other big kind of spaces in that manner, but they're serviced very well and well taken care of.
Anything else, Leslie? Pete?
The number of vacancies, again, can you repeat?
Currently?
Yes.
I believe it's about 7. Matt, I could be wrong though. It's kind of been a moving number, moving target.
1 second, I'm going to get you the number.
Okay.
Yeah. I think as of the end of the month, we were approximately, let's call it 7 to 10. I think that's a fair number.
Yeah, that's a fair number, Josh.
Okay.
How many of the units are going to your employees?
I believe we have 2 employee units at the property.
Okay.
Because the property manager actually lives on site as well.
That 49th Street has had a problem with illegal rentals to Airbnb. How do you plan to address that issue?
They actually have some actions on them, don't you?
Yeah. Unfortunately, we have tenants who rent units and don't rent them to actually live in them. They go ahead and they do Airbnb or other things of that nature. Ultimately, we don't profit from that. We end up paying the fine. So whenever we see people walking in with suitcases, at times that international flights usually land, we do our best to try to meet them at the door and say, hey, where are you headed? And then, luckily enough, 90% of the time they're pretty clueless and they'll say, oh, here's our Airbnb reservation. We're headed to unit 5B in 318. That's not the real address, but just an example. And we usually then try to intercept that and stop that however we can within our rights. Outside of doing that, there's ultimately just not too much we can do to control it. Our hope and our belief is that when people go through the Housing Connect system and the lottery system, those are not people that are then going to go ahead, after they certify their income and, made this their residence to go ahead and do that. But, there's no really much better way for us to police that than what we've done in the past. And, we've tried to be as efficient or as useful as we can there, but some of it's out of our hands.
But you will be able to now. The agreement's been made.
That's absolutely our goal.
No, but the city and the Airbnb made an agreement to disclose addresses, so therefore that'll be available to owners.
That's correct.
Right. Okay, going to Martin.
Sorry,
Pete. Yes.
How many of the units are going to be renovated?
Well, I don't have the exact number of units that are renovated, but I can say confidently, and again, Matt can tell me if I'm completely off base here, but I would say that currently 150 to 160 have had some type of cosmetic work done to them over the last decade or so. And that could be one got a new kitchen, one got a new bathroom, one got new hardwood floors, somewhere along those lines. So a good portion of the building has had work done to it. It's probably a greater number than 150. All the hallways, front doors, intercoms, all that's been done. That I can say for sure over the last 10 years.
Yeah, I thought that Zeckendorf addressed that issue many years
No,
ago.
these are not the Zeckendorf buildings. Those are further
Okay.
down the block.
Okay, that's fine.
Dolores?
Oh, one more question.
Oh, sorry,
ADA
Pete.
compliance? ADA in compliance? ADA?
Russ, Matt?
I didn't hear the question, it froze.
ADA compliance?
ADA compliance.
Is it part of the regulatory agreement? Is that the question, or are they current?
Yes, both.
Are they currently, and yes, and are they part of the agreement, the regulatory agreement?
It is not part of the regulatory agreement now.
Currently, they're not ADA compliant.
We lost you, Matt, entirely. You broke up.
Can you hear me?
Yeah, now we can. Yeah.
Sorry, they're not currently ADA compliant. All of them require you to walk up steps to enter the building.
Bathroom? Bathrooms?
Are the bathrooms ADA compliant?
Yeah.
Sorry.
Or will they be?
Let me try to reframe the question for Pete. In the event, have you done major renovations which kick off ADA compliance? And if you have done them, so you've never done, I think, Pete, here, their level of renovation in the buildings to date and anything planned would not trick. So you've never done a major type 1 alteration here. It's always been type 2, right?
That's correct.
Okay. So Pete.
How many seniors living in the buildings?
What was, I didn't say the question.
How many senior citizens?
I don't know the answer to that.
We don't have that statistic.
You must know that.
I can't tell you exactly how many senior citizens live in the building.
Okay, we can ask your property manager. I guess the question.
I mean,
here
we have no reporting required. Like we don't, we don't certify people.
No. We're asking a broader question. You have the aging in place thing, right? And we're going to assume that some of those people are going to be senior citizens. So
Absolutely.
Our question is, how many from your just anecdotal information from your property manager, because those are the kinds of things that the question is, if you can't do a fully ADA compliant unit because it's a walk up, right? But can you do bars and stuff like that to make the unit more useful for a senior?
Yeah, well, that's what we're willing to do with the aging in place. That is bars in the bathrooms, bars in the kitchen, lowering of things. I mean, that's what we're offering.
So it might be helpful then. Give us some detail on that, how that sub program works, Russ. That'd be helpful. Okay.
We can send you there's like a flyer on it that breaks it all down.
Great.
And that's available to any tenant who wants it.
Right. That's not only for seniors. You don't have to qualify for that. Anyone in the building can get that.
So it's called aging in place, but it's available to everybody?
We're all aging in place.
COVID.
Okay.
COVID.
And Joe, just to let you know, right now we have 4 tenants that receive a SCREE benefit. So if you were asking how many, based on not anecdotal, but based on the rent roll, we can tell you that we have 4 tenants that receive SCREE.
Okay.
So those would definitely be senior citizens.
Right. So that helps give us a beginning of a part of a picture. That's good.
It would be interesting if three of those 4 were the ones that asked for aging in place.
Right.
Yeah.
Pete? Any further questions? Okay. Hector? Sorry. I'll get back to you, Dolores, in a second.
Yeah. Okay. I don't know if this was answered during the presentation. I didn't catch this. On the tax abatement, does that coincide with the 40-year term for the proposed, I guess, for the plan itself? Or how long is the tax abatement?
40 years.
40 years.
40 years, so it coincides with that. Okay. Secondly, looking at the proposed improvements, it looks like it's all cosmetic on the outside, not on the interior apartments. Is that correct? I mean, I'm looking at the presentation here.
Yeah, so what I can tell you is that as part of the application or approval process with HPD, they make us do a property condition report. And the items that we listed are the items that came back that need, let's call it immediate or, need to be repaired soon. And those would be the items that we're required to repair, more or less immediately or soon. And that's why we put those on there, because that's going to be our requirement.
I see.
Because
Josh,
yeah.
Sorry, Josh, correct me if I'm wrong. You did work before. You've already done some work in the buildings.
Yeah,
correct?
we've done plenty of work in the buildings. We did a lot of facade work just a few years ago. There was an issue where, whatever. We've done plenty of work as is, but those are the things that are going to be required in our agreement with HPD, and that's why we listed them there.
So, and so therefore you have a written scope of work that's already been approved by HPD.
That's correct.
Gotcha.
Correct.
Okay. Okay. So I guess that's pretty much it. My concern was, one of which was, if there were going to be interior apartment improvements like structural, what the accommodations would be made for the tenants, but it doesn't sound like any of that's going to really happen unless it's on an emergency basis or needed.
There shouldn't be any displacement of tenants. That's not at all in the plan whatsoever.
No. His question is, if you were replacing a building system like plumbing, how do you provide for services in the meantime?
We haven't had to deal with that here, and that's not in the short or long-term plan for the moment. So I don't have a good answer. It's certainly not something we've outlined at the moment.
Okay. Dolores?
Okay.
Had I not been born and raised in the area, know the block very well, and Paul, yes, I remember before Worldwide Plaza when that was just an empty lot, and seeing the renovation on the outside and how well it's been done, I would have never guessed that from your presentation. And I'm only giving you a knock because I found that you were very unprepared for a lot of the questions that are very important for us to be supportive of a project which on paper sounds fantastic. You were providing all the income bands that we want to provide for folks that we want to keep in the neighborhood, so we provide that balance. You also are providing long-term stability by rolling back when there is turnover in your market targeted rents, so we appreciate that. It's just not very clear. Your presentation did not allow for us to be able to advocate for you as much as we would like to, because it was very choppy, and it doesn't seem as if you and your team have everything down in terms of exactly what you're doing in this particular space. And I question how well you actually know the block, not knowing the type of residents that you have in there. So that's just a knock on the presentation. The project itself, very supportive of it. I do have a question about any of the commercial units that you have. Are there any provisions for affordability for those units that have commercial?
They're not covered in the agreement.
Okay, so something like spoiled brats is at risk of their rents being moved up and losing that space.
Technically, they're not covered under the agreement.
Right, and the commercial units aren't subject to the tax abatement either.
Right, I understand that. One of the other issues that we have is affordability of properties as well. Mom and pops have been squeezed out. This block formerly had all mom and pops up and down. There have been a few vacancies off and on as rents have gone up, but there's a few that are still hanging on. So if that is a way in the model to consider being able to provide protections for some of those long-term tenants, that would be appreciated.
A question that we missed here. 1 minute, Pete. And that is, there's a homeless requirement. Those 30% units for homeless. Can you explain specifically what is the ranking and how that happens in terms of any future rental?
So that's a citywide requirement. So with any Article 11, you have to give a certain percentage to formerly homeless, and that really what that means is that the referrals are coming from DHS for individuals or families who were formerly homeless who are transitioning into long-term housing.
Right. My question is, of the the units are all designated in advance as to what is at 30, 50, 100, 110. Is that correct?
That's right.
So in the regulatory agreement, the unit numbers and building numbers are listed.
They don't list them in the regulatory agreement, they list them in a letter.
It's usually an attachment.
But they don't list the specific units. In the regulatory agreement, they don't say that unit 1A is a 50% of AMI unit because they think that violates tenants' privacy rights. So they do that in a letter.
The tenant's privacy rights? I have multiple regulatory agreements, Russ, that list every unit and say what's happening with which.
Yeah, HPD is not doing that here. And that's the reason that they gave us.
That sounds, okay, so how do we know which units are, this letter, where does that live and is it recorded?
It's not recorded, it's referenced in the regulatory agreement. And obviously we can share that with the community board.
If it's not recorded, where's their enforceability of knowing how to hold people? How do we know how to hold this owner accountable going forward? Your entire management team leaves and we have complaints. How do we know a letter is out there?
Well, we're happy to share it's called the side letter. It's referenced in the regulatory agreement. And we're happy to share that letter agreement with the community board.
I think this
So
is more
you'll
of a question for HPD, that it's again, one of these things where they're super over-regulated on items and then they don't record a document that says unit X is this AMI unit. That just sounds rather foolish. I know you're not going to respond to that, so I'm not going to ask you to. So we need to have that, but the question is, my question is more specific. You have a list of units now. When a unit becomes available in that side letter, that governs which AMI band is available. Is that correct or not?
That's correct.
So the homeless rentals do not have priority over everything else. Is that correct?
That's correct.
Okay. We're going to need you to articulate that to us so we can engage with this, because part of the work that we do here is we do this discussion, we put together a letter, and then we have a representation from the applicant as to what they will do to commemorate our understanding to it, and we put that along in our approval to the city council.
Okay, understood.
Okay. Katie?
Well, as I indicated at the beginning of this call, I'm new to this committee, so this is a lot for me to process, and I'm likely to ask a really stupid question right now. So just getting.
There are never stupid questions like this. That's how we all learn. Period.
Oh no, mine's about to be. Trust me. So my impression from what has been said is that basically there are incentives in place, and that the affordability will really be available to people who don't live there now, but who move in later as a result of the lottery. In other words, it seemed like, if I understood the discussion earlier about like when the rates kick in, it sounds like somebody who's living there now without a lot of money could end up, they're going to keep paying whatever rate they've been paying. Whereas somebody who moves into their apartment afterwards, if they came in as a result of the lottery, then they're going to get a lower rate. And I guess I'm just wondering, is that just a decision by you? I mean, couldn't you decide even now to make your apartments not just for the people who will move in later, but for the people who are there now based on AMI? You could commit to giving them the lower rates?
Katie, let me take one part of that first.
Please do.
One of the problems is that the current tenants may be totally not in the AMI band that the unit's restricted to, because nobody here was put in for income test. They just rented an apartment. So I rented an apartment, I make $85,000, and I'm in an income band unit that is 80% of AMI. How do you work through that? It's kind of Russ, it's kind of a mishmash of who's there, right?
That's right.
So and it is an odd thing, because normally in the Article 11s we've dealt with, they have a Section 8 component, so we know exactly what the AMI bands are, so it's very specific.
That's correct.
In this case, it's a little bit different. And I think you've really honed in on something that is, how do you benefit, how do you preserve people who are there? And the sense is, how this is set up, it doesn't work that way, really.
And indeed, it almost seems like it incentivizes people to move out in a way.
You recall that there are already rent stabilized in these units, as was in the presentation. So there are folks that are protected at the rents that they're in. And don't think of it as a penalty for those that live there now. Again, as you may know, people come in and out of the neighborhood and they live only here for a little while. They find a place, they may have any income ban. This is literally keeping our future supporting income bands that may not be able to be here if everything was at market rate. So we're not disadvantaging the folks now. What we're doing is we're advantaging folks that come into our neighborhood that would maybe not be able to live here if everything was market rate.
I mean, it actually creates the affordability over time. And although I questioned the 30 to 40% turnover, that's what this owner says happens. But I will guarantee you that when somebody who's making 84,000, I mean, the phrase I always use is that when my office, Clinton Housing, did this development on 53rd Street between 10th and 11th Avenues, we got 57,000 applications.
Yeah.
Moderate and middle income units, because they're simply not being produced all over the city.
Yeah.
And it was overwhelming.
Yeah.
And there are now waiting lists of people making between 50,000 and 100,000 to get into that building.
Yeah. So I guess I worry about the people who we have already who are really struggling. And so absolutely we want to make sure that people can come in who, for the focus on the future, but I also sort of feel like, is there anything we can do for the people who are already there? But
that's why we also tried to create this program with some sort of arrears forgiveness for those certainly now who are having a tough time getting by. And I don't know that that's been done before. And we're going to try to implement it smoothly without anyone being able to take advantage of it, because I think it should go to those who really need it.
And actually, just to that point, I guess earlier you said that assistance was going to go to people who hadn't paid their rent.
Correct.
So, but it made me think, like, there may be people who paid for the last 2 or 3 months, but they're not going to be able to pay going forward. Are you going to hear them out?
The problem with going forward, right, is it's one thing, at a certain point, if you say, hey, no one, if you paid the last few months, but you're having a tough time now, on a going forward basis, don't pay the next 2 months. At some point with our lenders, it starts to become a murky world. We said, all right, this already has not been paid. And trust me, we appreciate those who did pay it, and it was tough for them to pay. But to all of these situations, unfortunately, there's no absolute perfect solution. So we're kind of doing the best with what we can and trying to be creative so that everyone will get some benefit today. And this is what we've come up with.
And do you have a sense of what percentage of people didn't pay their rent in the last couple of months?
Yeah, I would say at 49th Street, more or less 20 to 25% have not been able to pay their rent.
Okay, thank you.
All right, any other questions, Katie? Okay, Pete?
Regarding the rent rollbacks, how many of the units were due to previous rent overcharges?
I don't fully.
How many rents were raised due to, do you have any overcharge claims in the building?
Do we have any current rent overcharge claims in the building?
There is a rollback in rents, and I'm wondering if some of these units were getting a rollback as a result of rent overcharges.
Absolutely not. No. The rollbacks are due to receiving the Article 11 tax abatement, right? So even on rent stabilized units are receiving rent rollbacks. It's across the board. This has nothing to do with the DHCR issue. This is part of the negotiation with the city that if we were going to receive the tax benefit, they wanted lower rents across the units. This isn't a slap on our wrist. It's what is coming out of this deal.
It's part of the program in general.
Yeah, it's just that I know the history of the people who live in it and that on that block, and the fact that the number of people that are paying market rate is far greater than the number of people that live there at one point it just amazes me.
Let's go to James, who hasn't spoken yet.
Yeah, it's a very creative program. I guess I'm just a little, I'm interested in the sequence of events. If you could just sort of clarify the timeline. Was this the plan all along? And if it wasn't, when did this plan come into being in this way? If you don't mind.
It's a fair question. So, you know, about 2000, in the 2000, I don't exactly remember when we took over Montauk Housing, but that was before Montauk Housing. It's a little bit of a long answer, so I'll give it to you. We had purchased a very distressed portfolio with a lot of project-based Section 8 properties in it. It was called the Triborough portfolio. It was the second largest foreclosure after Stuytown. Working with those project-based Section 8 buildings, we started to understand the Article 11 programs and what they meant and how it worked. So, you know, we started to, you know, explore it. We tried to do it on another currently occupied non-project-based Section 8 building, so similar to 49th Street. And there was just an incredible amount of hiccups with the city and with us. Like, it was hard. It was new towards that type of product, and we just couldn't get it done. Then we started doing it more frequently or got into it more with HPD towards the end of 2018. And we kind of said, okay, everything that we want to own for more or less, in our minds, forever, let's call it, assets that we want to have and we want to manage and are important to us, we'd like to try to get into this program. And we systematically did it with new purchases in 18 and 19. And then this year we started coming with assets that we had already owned. And we put this building into application, I'd say, in the fall of 2019 when our previous projects closed with HPD and they were all successful.
So the economics of this project, it had always been contemplated that it would be Section 11 or Title 11, Section 11?
Article 11.
Article.
No, James, no, it was not.
No, so in 2016, no, I don't know that it was. You know, at the same time, we certainly tried to always learn and jump on to, you know, new ideas, new concepts, and be, I'm not going to say innovative, I don't know if that's the right word, but creative at the very least. And when we saw that we were having success in other places with this project in existing buildings, that's when we did it. I mean, this definitely isn't in any way a response to COVID and you know, us trying to, I don't know, but, you know, in general, we're trying to shift our new purchases, and that's what we're doing on our new purchases, and we're trying to shift our business model to this. We think it's the right thing.
So I want to pull everybody together. We have two more members that haven't spoken, and we are now at 9:06. As I said last month, got to keep moving it. So let's go to Martin and then Maria.
My follow-up question, though, is for you, Joe.
Yes.
Is it different from the longstanding policy of requesting permanent affordability simply because it's a different title, or?
Yeah, the Article 11, the Article 11s have a term, and they're not new developments. They're really a preservation tool. When we did this for 53rd and for 48th, it was the same general thing on it for 40 years. So let's go to Martin and then Maria.
Yeah, I learned a lot. The developer pays taxes, right?
Yes, there are. This is a tax exemption. It's not 100% at all.
Yeah, but and I love the spread of comment.
Right.
Golden question. Thank you.
Okay, we have to go to Maria, though. She hasn't spoken.
Can you hear me?
Oh, we certainly can.
Yes.
Oh, okay. I had questions. Most of them were answered. The only other thing, I just wanted to clarify something. There's 213 units today that are rent stabilized, 54 that are market rate. And then out of the 54 that are market rate, 29 of those are becoming rent stabilized. I understood that correctly, right?
Yes.
Okay, great. And, oh, and then just the other thing, most of the units were 1 bedrooms, I believe, right?
No, we can get you an exact unit mix. I'm sorry I don't have it, but no.
Yeah, we'll leave that too.
It's almost split 50-50, 1 bedrooms and 2 bedrooms.
We'll get you an exact unit mix by tomorrow morning, 9 a.m.
Okay.
Yeah, if you can send that over to the office, thanks.
Absolutely.
So let me try to sum up what we learned tonight and our concerns. That it's a 40-year term. We know that there are currently 54 market rate units. 29 will be returned to rent stabilization. We have this aging in place program, which we're going to have more information about. And we're going to bring HCC into this mix to work with this owner to flyer this building, because I think, right, the March moment was not the best to say, do you want something at all? All right. And anyone who opts for it, then the owner will do this aging in place, which is a limited scope. We learned that there are 4 tenants on SCREE, which is senior citizen rent increase exemption. The units that are vacant, upon vacancy, will get upgraded. We have to figure out, and the owner agreed to put that in somewhere in the agreement, so we note that that happens, so there can be compliance on that. We spoke a lot about the AMIs, and Russ, if you can just shoot to us a nice chart pulling the AMI information, especially when the bands are a little bit wider, so we can embody that in our letter appropriately based upon household size. And I'm assuming we're only talking about 1, 2, or 3 household size, right? In this building?
Yes.
Right. There would never be larger families here. They're very small apartments. Right.
Yes.
So we then learned also that the taxes are a function of how many units actually come into the income restrictions, because if there are units like Katie talked about who are paying a higher rent now that are restricted but not occupied, income restricted person, that in fact the tax bill is a calculation, and Russ used the phrase shelter rent, specifically meaning it's annual, Russ, right? This calculation?
It's annual.
Yes.
Yeah. So there's an annual calculation saying here's how much they're making, here's how much it is, and the maximum benefit is roughly 28 million, but they may not get that if they're actually having less people turning over.
And that's over the period of 40 years.
Of course, but you get more benefit on an annual basis on the more that turn over and become restricted. Because when you turn them over and they're restricted, you get less rent, so therefore you need the offsetting benefit from the tax exemption. We talked a little bit about the lottery, and our applicant is very optimistic that it'll be 90 days. We should question that. And we definitely want community preference here. I believe, just give me a nod of heads, we would not approve this without community preference, correct? Right, okay. The current vacancy is roughly 7 to 10. There's on-premises property manager and super. Airbnb enforcement was raised, and now there's going to be data so you can actually do it. So we'll note that in our letter. You're going to get us numbers of already renovated units, approximately. So we can embody that in our letter, and the unit mix. You didn't note you are going to remove all violations, but you mentioned that before. So that happens as part of this, correct?
Yes.
Okay. And you've never really filed for any type of renovation, alteration that kicks off ADA compliance.
No.
There is a scope of work that's HPD approved. You have the detailed version of it. We'll attach that to our letter. Get us that. And then the commercial units are not covered as part of this. In fact, there's full freight of taxes on the commercial units, real estate taxes. You're going to do this COVID-19 rent forgiveness for April, May, and June, and that's going to be available to all tenants, right? Or just the restricted ones?
All tenants.
All tenants.
March, April, May.
March, April, May.
Right. Got it. And the formerly homeless, in general, there's a homeless requirement, but there's an embodiment in the regulatory agreement via a side letter of a list of units. So our question that's going to be, and I'm assuming we're going to want to put this in our letter, we want there to be that to be recorded. Otherwise, we have no idea how this gets enforced going forward. Is that a yes from everybody? Yes? Okay. Did I miss anything from our discussion? Anyone? Any committee members?
No, I move that you write that letter.
Yeah, I kind of got that. So that's a motion from Dolores. Is there a second? Second from James. All those in favor, raise your hand physically. All those against? Any abstentions? President eligible to vote. Okay, it passes. We thank you very much, and we're going to get some more information from you. And when is the? So I want to know for the committee is that one of our issues is that they're trying to get to the stated council, the stated meeting of the city council to approve this. And when is that meeting?
June 25th.
So one of the things I just want to counsel you on, given how rapidly HPD responds to things and resolves things, we're going to put together this list and we'll work with the speaker's office to get it settled. But think about it, right? It may not happen on June 25th. If HPD doesn't respond, that may be an issue that it gets heard and then held over.
I mean, if it happens June 25th, our goal was to ultimately close with HPD June 30th.
Oh, no, we're totally with you to do this and to close. And it may help you that they want to count these numbers against their June 30th closing. But getting their attention, we're going to ask Russ and Ben to assist.
Yeah, absolutely. What's the biggest issue that we need their attention on?
The two issues are the community preference and getting this side letter recorded so it's enforceable. That's what it sounds like to me. Is that correct, committee?
Mm-hmm.
Yeah.
We'll do
everything. Joe, I just note, and we can definitely talk to them about, we don't have an issue recording the side letter.
Right.
But the regulatory agreement does say, hey, a default, if you're not in compliance with the side letter, that it's a default under the regulatory agreement. So
yeah, I'm just talking about 5 or 6 years hence, there's some issue about it and everyone's running around. We have these 80-20 documents that you have to go to 17 places to find out what the compliance is. So we want to make this as clean as possible, that's all.
Okay.
All right, I think we have a support here with 2 qualifications. So we'll put this together and it's going to be brought on Monday night to exec to discuss. It won't be in a final written form because it can't be, but we'll move it as soon as we can, okay?
Thank
you
you
guys very much. And we thank you for,
Thank you.
you worked us heavily. It was very difficult because this could not be managed during COVID. We're at the other end of trying to breathe now. And thank you for expressing this very clearly and putting it out there. Thanks a lot.
Thank you very much. Good night, everyone.
Good night. Okay, Nelly, bring the next group in. And by the way, guys, we're at 9:15. 9:16. You're slow. Now we're on to Ryan Center. Take it away,
we have Will and Dan. We have Will and Dan, and they already know that the presentation they're about to give is going to be short and sweet because we need to wrap up as soon as possible, please. And I know you guys would like to as well. So Ryan Chelsea Clinton Community Health Center is on 10th Avenue, right off of 46th Street. They offer a variety of health services to all ages, including dentistry, optometry, behavioral health, other services as well. And actually in February, they were before us talking about their opioid addiction treatment program. And today they're just giving an update on their services and what it looks like right now, as well as community outreach. Thank you. Will or Dan, I don't know who's presenting.
Thank you, Maria. I'm unmuted. I want to thank you and the committee's time to present this evening. Given the hour and you guys have just been through this for 2 hours and 45 minutes, like my hat's off to you. So we'll make it brief and focus on some of the more poignant things. So as you know, Ryan Chelsea Clinton's we opened our doors in 2001 on 10th Avenue between 45th and 46th. Next year will be our 20th anniversary. So we're very excited about being in the neighborhood for 20 years. Ms. Gonzalez, can I have the next slide, please? Or do I control it? Or?
No, she does.
Okay, awesome. So Ryan Chelsea Clinton's part of a larger health network known as Ryan Health. It was named after Congressman William F. Ryan, who was a leader in the war on poverty in the 1960s. He passed away of lung cancer in the early 1970s, and the health network was named after him. Next slide. And so as a federally qualified health center, as there are about 1,000 across the nation, we are dedicated to providing high quality, comprehensive, culturally competent health services to underserved communities. Currently, 70% of our patients live between 14th Street and 79th Street, west of 5th Avenue. And about 70% of them live under the federal poverty level. So we're definitely reaching the target audience, target patient population through our programming. Next slide, please. So that's our vision. We were the third established community health center network in the entire nation. We've always been a leader, whether it's around HIV, substance abuse treatment, behavioral health integration. So that picture, I don't know if Maya Burlow is still on the line, but when COVID first hit in March, March 19th, we started to feel it more. We were very concerned about personal protective equipment. So we reached out to many local elected officials, and to the left there of the picture, it's a little hard to see, but that's Senator Hoylman. He called us and showed up one day with 30,000 surgical masks. So we're grateful for that, because we did not, like most health centers and most health facilities, did not plan to have so many, but he came through a constituent. So we're grateful for his contribution. Next slide, please. So this is really important. You know, given the huge economic impact of COVID, the expected poverty rate among individuals, it's really unknown, but you can see it from doubling to tripling. Children living in poverty, they say it's going to double and triple. So as a community health center, we provide services to everyone regardless of their ability to pay. So if you know someone who's lost their job and has no health insurance anymore, or someone who didn't have any health insurance before, they can come to us. We'll help them apply for Medicaid if they're eligible. If they're not eligible for Medicaid, we'll put them on a sliding fee scale. The sliding fee scale goes very, very low. We work with Thriftway Pharmacy and ESCO, but mostly with Thriftway, which is on 10th Avenue right across the street. And we have a sliding fee scale for pharmacy or medications. Doesn't make sense to us to come see a doctor and then get prescribed a medication you need for your well-being that you can't afford. So we're grateful to work with Thriftway on 10th Avenue and ESCO on 9th. And we have some other partners who are independent pharmacies in the neighborhood. But if you know someone who's struggling with their health, please, and concerned about their ability to pay, please refer them to us and we will make it work. Next slide, please. When COVID hit, we had to, we have a residency program from Mount Sinai, Morningside, and Mount Sinai West. Some of the doctors we contract with through Sinai, they were all pulled back to staff the hospital wards. So we used to have evening and Saturday hours, but for now we're just 8:30 to 4:30 during this period. Next slide, please. This is actions we're taking to make sure that our patients are safe, the community is safe, and that our team members are safe. So everyone in the health center wears a face mask. It's really required. If a patient comes in and doesn't have a mask, they are asked to wear them. On one or two occasions, we have people who don't want to wear masks, so we immediately put them in rooms. There's hand hygiene is everywhere. Also, when you come into the door, there's a thermoscan to see if you have a fever. There's also screening questions that we ask to see if you need to go into an exam room immediately, and if whether the provider needs. What happens if you say that you think you've been exposed to somebody with COVID is you're immediately taken to a room, and there's a computer screen there, and a provider will ask you additional questions to see if they need to don the personal protective equipment, because we're trying to make sure that we conserve it and use it when we only absolutely need to. So we're really trying to to protect everybody. Next slide, please. So social distancing, we only ask that when one parent comes with their child if possible. We really don't have any other visitors. We have protective screens. We have spent much more, I've spent in probably 1/4 in 3 months what we usually spend in 18 months on cleaning and disinfecting equipment and supplies. We are constantly wiping down all high touch areas, the exam rooms, and we've also placed these visual cues to help people to remember if they have to stand on the line, or also just to, it is amazing that when you say, oh, stay 6 feet apart, I saw a study that when you ask people to do it, that what people thought was 6 feet varied greatly between person to person. So we have these visual cues. Next slide. So something, if anyone's ever been in our health center, is our waiting room is sort of this large open atrium with a beautiful skylight, but it created some challenges with having everyone have to be 6 feet apart for social distancing. So we created these waiting room pods. This was sort of the mock-up before they were zippered up. This allows us to have about 75% of our pre-COVID waiting room seats, and everyone can sit 6 feet apart from each other. So it's just our way to ensure everyone's health as they enter come into the waiting room. Next slide, please. So telehealth. So actually about 70% of our visits now are through telehealth. So that's either through phone or through iPad, computer, tablets. One of the challenges that we face is that with a underserved patient population, many people, or some people, do not have access to smartphones or any phones with a camera. So we still have some in-person visits that go on.
You said aging population, right?
No, underserved, but also aging as well.
I heard you say Asian, that's why.
Oh, aging or Asian?
Aging, yes.
Aging, A-G-I-N-G. But it's a good point. In the beginning, many of our aging individuals are not as technology savvy as some of our younger patient populations. I will say, as the pandemic has moved through time, is that neighbors and friends or relatives of the people, of the aging individuals or individuals who are not so great with technology, have started to help them out. Some of the aging individuals have, or people with chronic illness have home health aides. And in the very early part of the pandemic, home health aides were not always coming, but that started to improve in the last month. So we do have telehealth for new patients or existing patients. Next slide, please. So here's some numbers, and I guess we can send this out to the board if they know anybody who needs to make an appointment. We have a portal where people can make appointments, check medications, get lab results, talk to their provider, send electronic messages to their provider care team, and since COVID has started, that's utilization of the portal has increased by over 350%. Makes sense. People are staying safe at home, but they're still trying to communicate with their healthcare providers. Next slide, please. Yeah, so these are all the services that we do. We pretty much are doing everything right now in person. We still have X-ray. Optical services restarted last week. Actually, on Monday, dental services will restart. The American Dental Association and the Center for Disease Control and the New York State Department of Health have come out with a new way of practicing dentistry to ensure that it's incredibly safe, given that many dental procedures create aerosols, and as we all have read, likely that aerosols are one of the big ways that COVID can move around in space. So we have special airflows that have been put into the rooms, certain lighting that has been put there to try to diminish the length of time that the virus lives. and also a lot of protective equipment. Next slide. Oh, that's like halfway through. I'm almost, was there any more? Sorry. Oh, gotcha. Okay, so sorry. So we also are doing antibody testing at Ryan Chelsea. So we've done about 550 tests since we started doing antibody testing. Our positivity rate is around 32%. So about 32% of the individuals testing for the antibodies have come back positive. In Manhattan, the rate has been about 20%. Or 22%, depending on the week that you're looking at. But as you may have read or have known, is that COVID has been disproportionately affecting communities of color and individuals who are living underserved neighborhoods, living in NYCHA housing, and so many of our patients come from those groups of individuals. So we're not surprised that our positivity rate is higher than the overall one for Manhattan. Our patients are not fleeing to the Hamptons or fleeing somewhere else. They're just trying to stay safe in place. So we continue to offer this. We're not encouraging people as a community health center just to come in for an antibody test. We really want to be your primary care medical home. So, but if you are interested in knowing your antibody status, we can do that as well. Next slide, please. So we do have one of our centers that was very small up in Harlem, Frederick Douglass and 128th Street. So if you're interested if you feel like you have symptoms and you feel sick and you're not a patient of ours already, is that you can call the state hotline number and you can go to a Ryan Health facility in Harlem and get tested to find out if you actually have active COVID at that time. Next slide. So something else is that while everybody's, I guess before what's Monday, phase 2, they say, is we started doing HIV tests through the mail. We had to rethink how we normally do things as we tried to keep people from coming into the center as much as possible. So we are now doing home HIV tests. There is a care manager who will contact you and talk to you about some of your risks. If the test result comes back positive, there is social work support staff and others who are there to help you process the results. Next slide, please. So something that the CDC has come out with, and we see in our own health center, and we've seen all around the state, is that because parents understandably are nervous to come out of their homes, is that pediatric vaccination rates have tumbled dramatically. So even though we're in the pandemic, as things start to improve or change, it's really important to encourage individuals with kids to make sure that their children are getting the vaccinations that they need. We don't need outbreaks of measles on top of having COVID in our community. We don't need outbreaks of other childhood illnesses that we've already conquered during this time of COVID. So encourage all your friends and neighbors with children, make sure that they're getting their vaccinations, please. Next slide. Also something that we're working on is that, as with COVID, is that, and social isolation and social distancing, is that individuals with, at all levels are experiencing higher rates of anxiety, stress, depression. So even though this is an older slide that has somebody unmasked individuals in a room, most of our social workers and psychologists are working actually from their own homes, and they're getting referrals from our doctors. We're doing telehealth or talking to their patients on their current caseload. So a lot of it is, almost all of it is telehealth. And we're, social isolation is really tough on everybody, and as we all know, and the number of people scoring, having indications of depression on screenings has skyrocketed since March 19th. Next slide. Also is how do people cope during, some people cope during stressful times is they turn to alcohol or other substances. So we've also seen higher scoring in for individuals who are needing treatment. So that's Dr. Zara Siddiqui, who's our medical director. We've been trying to keep on with the Suboxone and also referring people out to social workers. We have 2 CASACs who we use for substance abuse treatment counseling. Next slide. Geriatric program. I have no idea why that picture is associated with this, but we still have a social worker who works for seniors, especially during social isolation. They've been doing frequent, a little bit less therapy and just more contacts just to ensure that individuals have someone that they can talk to a little bit and not feel so socially isolated. Next slide. We continue to do PrEP and PEP. We still have HIV testing, and we will continue to do that. Next slide, please.
Dan, are you you're nearing
Yeah,
the end, right?
Yeah,
Okay.
we do that. Next slide, please.
Thank you.
She's just letting you know that we're nearing the end of our.
No, I got you.
Any more information?
So this, I think this is the last slide, though I could be wrong, but this is the last one I'll talk about. Is that also, so the, the massive furloughing, unemployment issues that are going on is, besides providing primary care, is we have dedicated benefits navigators. So if people come to you and say they are food insecure, they need health insurance, they need assistance with public assistance, they need phones, we have people on our staff who will call or they will be in person, will help people access benefits. So healthcare and benefits in a time of a pandemic, we're here to help people where they're at and their families. And I think I'll stop there just because.
Maria, I know it's late, but I did have a question. Dan, your funding, you were working on expanding the adjustments that you needed to make for additional protective equipment. Has that put you at risk of losing funding for some of the other things that you were working on?
So what I'll say is that we were very, very fortunate is that we were beneficiaries of the Payment Protection Program. That was one of the congressional actions that was taken in the early part of the pandemic. It provided us with 2.5 months of payroll. So we did not furlough. We only furloughed 2 dentists because dentistry was not permitted. But we also recognize that working is a way to keep communities together and providing income into communities and to families. So we were really trying not to have to lay anybody off. So we got I'll just be honest, we got $1.6 million for 2.5 months of payroll. So that really helped us to prevent other health centers which had over 500 employees, because that was the cap. If you were a big health center, you didn't qualify for that program, and they've had to let people go or furlough people. We watch every dime, but we're trying to do our best.
And in terms of PPE and doors, we had a lot of donations from the community. We were very aggressive in trying to find out different sources, direct relief. Again, our elected officials really supported us. And then, as Dan said, the PPP money enabled us to go out and try to source PPE, and we're at a good spot at the moment. But we will need more now as dental opens.
Great.
I mean, it's a healthcare facility. We make our revenue through seeing patients. And in March and April and May, our visits dropped by, even with telehealth, by about 50%. So, that's just hard. But with the additional federal dollars that came through, we were just able to maintain. And now we're really trying to, I also say as a healthcare provider, is we've started to see a lot more people walk through our doors for face-to-face. And some people don't really need to come. They could do a telehealth visit, but I think it's called social fatigue. People are tired of being in their apartments or their houses.
You mean like being on Zoom?
Yes, like being on Zoom. So, and coming to the doctor is a socially acceptable thing, right? So they come to their doctor and no one says like, what are you doing out of your house? So, but at the same time, that means we need to be very careful in how we rearranged our workflows, how we rearranged our physical space to make sure that we can keep people safe when they come. I'll take other questions if there are. I guess my take home.
I'm hoping there are none.
Yeah, my take-home message is if you know people who are avoiding medical care or need social services, please refer them to us. We will do our best to take care of them. It is a time of. Go ahead, Jim.
We're gonna sum it up, and I'm gonna try to reach out to you separately.
Okay,
my
perfect.
staff that does, we have a lot of supportive housing, had a lot of people sick. So I have a lot of staff that I'm concerned about getting tested because they've been exposed to so many people. And maybe I can arrange something with you to help that be easier for them, all in the neighborhood, you know?
Thank you, Dan and Will. And I would like actually if you could probably come back in a few months to give us another update, but you'd be like first on the agenda.
I learned a lot. I learned a lot from the first 2.5 hours. 21 buildings. I'm like, give me one building. This is the health center. I'm like, what's going on here?
So I want to say that this committee did better than last month because last month we had 73 people attending.
Wow.
So we're much better and it was much less contentious. Although it is very hard to do what I'm going to be very clear about. These highly technical, complex things are hard to do in this environment. To discuss zoning resolution and to go through this is almost crazy land. Yeah. And then to have this huge project, which the owners have been trying to deal with since March and saying, could you just figure this out when we could not just figure this out because there's so many elements to it. And I thought I had a lot of elements covered and the committee members brought up more things tonight. So this is really difficult and let's hope we can see each other in person at some point in the future because these screens are driving all of us insane.
So we'll send the contact information to Nellie to reach out to me. Anybody can. But good night, everybody, and thank you for all your hard work on behalf of the neighborhood.
Is there a motion to adjourn?
Motion to adjourn.
Yes.
Second. All favor. Nellie, God bless you.
All favor.
Yeah.
Thank you, Nellie.
Thank you, Nellie. Thank you, everyone.
Thank you.
Bye-bye. Good night, everybody.
Good night.
Thank
Thank you.
Thank you.
Good night.